Dear ladies, dear souls, dear colleagues, welcome to the third European Conference on Neuro-acupuncture in Lugano, following the first edition in London and Siena. Let's start with the greetings. Dr. MAINO is head of the anesthesiology department and director of the pain clinics in Ospedale Regionale di Lugano. Both clinic pain and acupuncture service are part of the Neurocentro della Svizzera italiana.
Giuseppe, thank you for having me here. It's an honor to welcome you to this third European meeting on neuro-acupuncture. I have always been fascinated by acupuncture and the history behind that. But in my history, the every day is more clear, more research is done around it with our colleagues from neurology departments and all the research that is behind it. So I think the combination in the joint venture that we created in Lugano between the team of specialists in acupuncture and traditional Chinese medicine, pain clinicians, and neurology, the Neurocentro is something that is a really added value and something that is unique in Switzerland, but I think also around the world. I wish you a very good 3 days of learning. I'm looking forward to listen all these lectures. But wonderful, thank you.
Now I invite here Laura Lauer, the president of ASA, the Swiss Association of Acupuncture and Chinese Medicine. Lara works at his practice in Chiasso, near the border with Italy, as a general practitioner and acupuncturist, but for some time now has been devoting herself almost exclusively to the acupuncture and neurotherapy.
Great, Stefanos. I'm very happy to greet you daily on behalf of the ALDO, Association of Integrative Societies of Acupuncture and Traditional Chinese Medicine. And the WFAS this year, the ASBACO organized, together with the French associations PAOLO and CFA and the Belgian association AEMA, the IGOR 2025 World Congress which took place in Antibes in France at the end of the first week of the onwards. The event brought together around 460 participants from 40 countries around the world and addressed a wide range of topics in the field of Chinese medicine and related practice, including political therapy, neurotherapy, and many others. I'm therefore particularly honored to have the opportunity to address you with a few words of welcome on the completion of this rather important international event, the third European Conference of Neuro-acupuncture. Switzerland, located in the heart of Europe, occupies a symbolically strategic position as a meeting and exchange colony, ideal for sharing knowledge, progress, and experiences. This Congress, therefore, represents a privileged opportunity to explore a discipline that integrates the ancient knowledge of traditional Chinese medicine with the most modern neurophysiological discoveries and offers patients an effective therapeutic method that can be easily integrated into conventional pathways. I'm sure that this afternoon as well as the next days will be full of inspiration and a source of updated growth and the future work of us. I wish you a very promise.
We are a great pleasure and a privilege whether with us today via video link from World Health Organization in Geneva, Dr. Kim. Today, Dr. Kim will talk to us about a new World Health Organization Global Traditional System strategy. Please, Dr. Kim.
Okay, thank you. Thank you, Chair. Good morning, good afternoon to everyone. Okay, thank you for giving me this opportunity. So it is my great honor, or also that great pleasure to join on this third European conference on neuro-acupuncture. So I think I take this opportunity to speak a few things that related with the WHO with the traditional medicine. So I think that we are connected with this neuro and acupuncture that is the European community is promoting. So today I'm going to touching on this some brief history, the WHO with the traditional medicine. Then I'm going to talk a little bit about some of the global landscape on the traditional medicine, and then just do brief outline of the new global traditional medicine strategy. So as you can see that now, the WHO has the more than 5-decade history with the traditional medicine since 1976. So that we have the of the past 5 decades, WHO has launched 3 global traditional medicine strategy in 2002, 2014, and most recently in 2025 this year. So through the implementation of the global traditional medicine strategy, WHO has made certain milestone achievement. For example, in 2019, that the first time WHO has included the traditional medicine chapter in the international classification of disease 11, ICD-11. And also that, as you may know, that in 2022, WHO has also launched Global Traditional Medicine Center in India. So I think that's a global center giving us new opportunity to further that developing global the traditional medicine with more science and technology and evidence-based way. And also you can see that from slide that we have several high-level international declarations that related with the traditional medicine. For example, 1978 Alma-Ata Declaration, as well as the 2018 Astana Declaration, and also that the 2019 and 2023 UN General Assembly, that the high-level political declarations all related with the traditional medicine. So what is important in this message that global community fully recognize that importance of the traditional medicine as a main source of the healthcare. So I think that's why international community encourage and member states that integration of traditional medicine into national healthcare delivery system. So I just will give you that some brief snapshot on the global landscape on traditional medicine based on the 2023 that global survey. So in this survey, we have tried to get the overall picture of the member states on the traditional medicine in terms of the policy, regulation, education, and training and program, etc. So as you can see that from this slide, more than 90 member country globally, they have a national policies on traditional medicine and relevant the national law on traditional medicine. And also that quite a number of countries, more than 100 member states, having kind of, national regulatory framework for traditional medicine product as well as the traditional medicine practitioners. Quite a number of countries, around 60 member states in WHO, they also have the university level training program on traditional medicine. So it means that traditional medicine is no longer informal healthcare. So it's already at the level of the university level. So you might also mention that I think some of the speakers also mentioned that like China, Korea, many other countries have a university level training program on traditional medicine. And also that the research is another important area in promoting the evidence-based traditional medicine. So quite more than 50 member states and globally having national research institutions on traditional medicine. And also that quite a number of countries, including that the traditional medicine service in their national essential healthcare service package, and also they have the national that routine information system already including that the traditional medicine services. So if you look at the what the population use on traditional medicine, so from this sort of global survey, we can see that from this slide, around 67% respondent of those countries report that around 40% until up to the 90% of their national populations are relying on traditional medicines. So I think that globally also that in WHO, 170 member country actually they acknowledging that country they use the traditional medicine in their own countries as well. So then also you can see that quite a number of countries having traditional medicine is the provide through private sector rather than public sector. But I think that is the still we need a long way to go. That traditional medicine is a part of the public health services in many countries. And we also look at if the member states having such a whether the essential medicine policy on traditional medicine. So we can see from this slide, around 17% of the member states, they have including that traditional medicine product in their national essential drug policy and list. So I think this means that the traditional medicine products actually quite widely used in primary healthcare services in many countries. Yeah, I think this is the pharmacopoeia. So I think in order to make the quality standard of the herbal product, that number of countries having kind of national pharmacopoeia on traditional medicine. So it's more than 100 countries actually have such a standard quality and safety standard of the herbal medicine in their own countries. Health insurance coverage is another important indicator. We try to get how many countries actually cover that traditional medicine service through their national or private insurance scheme. So as you can see that 43 countries having that kind of insurance schemes for traditional medicine service. And also that very interestingly, what we observed that the acupuncture is one of the most common that traditional medical modality that cover under different insurance schemes in many countries. Let me look at the traditional medical knowledge preservations, because as you know that traditional medicine is closely linked with the traditional medical knowledge. So how to protect and preserve those traditional medical knowledge is one of the key area and our concern. So as you can see from this, the 42% of the member states are having certain mechanism to preserving traditional medical knowledges. I think one of the reasons what we try to get what is the main reason that the people are seeking traditional medical services. So as you can see from this, often people are seeking traditional medicine for managing that non-communicable disease and also for the purpose of the disease prevention and palliative care and rehabilitation and so on. So I think that from the message this morning, this welcome message, I heard that acupuncture. I think that you have a value that acupuncture in the pain management as well as the rehabilitation. So I think this is the one of the advantage of the many systems of traditional medicine in those areas. This is just a snapshot on the key challenge that member states are, reporting that in the area of traditional medicine. So most the common challenge that member states are facing is the lack of research evidence and data, as well as the research funding for traditional medicine. Of course, that the proper regulatory mechanism for ensuring quality, safety, efficacy of traditional medical services, the another key challenge that the member states are, reported. So I think the based on those, I think the those key current global landscape of traditional medicine, as well as the challenge that are reported by the member states, we have developed a new global traditional medicine over the last 2 years through the extensive consultation with the member states and partners and stakeholders. So therefore, I think we successfully launched the new global traditional medicine strategy in May this year at the 78th World Health Assembly. So I think before I'm quickly sharing some of the outline of the new global traditional medicine strategy, I'm going to share that what the scope of the new global traditional medicine strategy. So as you can see from this, I just to highlight 3 key definitions of the traditional medicine, complementary medicine, and integrative medicine in this slide. So I think basically through the process of the new global traditional medicine strategy, we try to update the definition of traditional medicine and also that complementary medicine and newly developed integrative medicine. Interestingly, because you are talking about neuro-acupuncture, this multidisciplinary approach, I think it's one of the under the category of integrative medicine. So as you can see that integrative medicine referring to interdisciplinary and evidence-based approach in order to achieve the health and well-being by using and combination of the biomedicine and traditional and complementary medicines. So I think that's the way actually we see that globally that many member country as well as the medical healthcare society they are trying to combine this biomedical concept and traditional medical concept to achieve holistic health. I think this is a new trend that we have observed. So I'm not going to repeat that definition of traditional and complementary medicine here, but I think if you can see, look at this new global traditional medicine strategy in WHO webpage, you can also see this full definition of this terminology. So I think I think this is the as you can see the global traditional medicine strategy basically constructed with the composed of the vision, goals, and 9 guiding principle, as well as the 4 strategic objective and 8 strategic directions. So if you look at the vision, as you can see that through this traditional medicine, we are going to build that world. There is a universal access to safe and effective, people-centered, traditional, complementary, integrated medicine for the health and well-being of all. So in order to realize of that vision, we have a set of goals that is the advanced contribution of the evidence-based traditional TCIM to achieving that high sustainable standard of the health and well-being. So I think these are the vision and goal that the new global traditional medicine strategy has set. Maybe also take this opportunity to highlight 9 guiding principles, which is embedded in the this new global traditional medicine strategy. So in the process of the developing the new global traditional medicine strategy, we have a set of this 9 guiding principles, which including that traditional medicine has to be built on the evidence base, and also that we have to promote holistic healthcare approach through this traditional medicine, and also we have to be promote that the sustainable healthcare as well as the safeguarding biodiversity. And also we also highlight the importance of the respecting the human right to the health and autonomy, including that the indigenous people's right on their health and their own indigenous traditional medicine. And also we believe that cultural components is another important elements in developing, in building that healthcare delivery system. So the healthcare delivery system to be culturally also relevant and also sensitive. So I think that is the sum of the key guiding principle, in addition to kind of people-centered and community engagement, integrated health service, and so on. So again, this 9 guiding principle is actually the helping us to formulate the new global traditional medicine strategy, but at the same time, it's also guiding principle to the member states, how the member states to going to implement new global traditional medicine strategy. I think this is just to the brief outline of the 4 strategic objective, and also that the related strategic directions under each that objective. So the first and most important that key objective of the new global traditional medicine strategy is to build and strengthen evidence base for traditional medicine. So in order to achieve this, we have 2 strategic direction, which including that we support high quality traditional medicine research, as well as we need to also that find appropriate research approach to validating of traditional medical healthcare. So in this process, of course, that the new technology, including that AI, genomics, and so on, those advanced new technology to be fully applied to generating more evidence and data on traditional medicine. So the second objective is the building of the proper regulatory mechanism that's related with the traditional medicine product, as well as the traditional medicine practice and practitioners. So that's, I'm not going to repeat why that the regulatory mechanism is such important in ensuring that quality, safety of the traditional medicine services. So I think which is the second, the key strategic objective of the new global traditional medicine strategy. And the third objective, as you can see, that proper integration, that the traditional complementary integrated medicine into the healthcare delivery system. So I think that is the main, in order to achieve that universal health coverage, as well as the health and well-being, we need to integrate evidence-based traditional complementary integrated medicines into healthcare delivery system. So in order to achieve that, we also having proper national policy and framework for integration. And also we need to really have to integrate that traditional medicines throughout whole that care continuum and also across the life course. And then the fourth objective of the new global traditional medicine strategy is to support to cross-sectoral collaboration among the different stakeholders, because we are talking about the health and well-being of the people as well as the planet. So in order to achieve and realize those our common shared goal, I think we need to cross collaboration with the different sectors, not only the health sector, but also we need to collaborate with the the different stakeholder, for example, intellectual property right, to protect traditional medical knowledge, and also that the setting up kind of a proper the benefit sharing mechanism that which is the raised that from the use of the traditional medical knowledge and so on. So I think these are some of the snapshot of the new global traditional medicine strategy that is the embedded throughout the whole global traditional medicine strategy. So with this, let me just stop my talk. So thank you very much for giving me this opportunity. Thank you.
It's a pleasure for me to have Filippo Castrovilli. Filippo is always present at our events on Chinese medicine here in Ticino. So it's a great pleasure to have him with us again today.
This summit, probably first last, the objective is to be the British always between Western and Chinese medicine. So gradually is how can we this medicine will repair this kind of fracture between the two cultures, because in traditional Chinese medicine, the knowledge of usually the foundation of knowledge follow a peculiar path. Usually, all texts are referred as the most important. Evaluation of what she tries to do with acupuncture, as well as technical roots in ancient texts. The more you can go back, the better probably the information is. And this is a straight way of looking at this. We used to do that in Western society and Western medicine at a certain point in history. And this picture is placed here to, remember us that at a certain point we went from the Aristotelic concept of the ipse, looking back to, immediate knowledge of medicine, about, physiology and anatomy. And we started with this Emperor Charles I Habsburgo, and we see his hyperactive size, and also the kind of artist that is started to have a scope, started a whole new concept of understanding the body and studying medicine. So this kind of tradition follow different paths. But my question was, and then we can, and the person that over the guide my research in medicine is if it's possible that this kind of two paths can lead to a common destination, and this destination can be a better understanding of the human being. So we try with this presentation to reunification these two different way of looking at the human body. And I get that we have one right example is that we look at reality, but usually we just see one part of it. And so this our culture has to develop this kind of looking. This is the Vesario anatomical picture that just studied that famous Western anatomy that I described to you. And in the full practical simulation. It also absolutely in the presentation, so I will try to do that. Okay, so this what we came up to anatomical study, really detailed anatomical dissection that has led year after year, century after century to the current understanding of the human body, the physiology that we share in medical schools. And the yellow emperor, which was the other emperor at the picture, as of course in this famous test, has a really deep conversation with the most famous physician at the time, Cibolo, which is also a mythological figure, and that was how Chinese medicine and acupuncture especially was born. And all the concept that we had about the meridians and the way we study Chinese medicine nowadays in Europe is based basically on this more than 2,000 years old past. So this concept and this picture shares a beautiful picture in Chinese tradition. It's regarded as the three healing artists and depicts the three important figures in the Chinese culture and philosophy. It's Confucius and Lao Tse and the historical Buddha. So they share they taste, all the three of them taste the vinegar, but they have different expression in their faces. And this reminds us that even if we can experience the same truth, maybe our understanding and our way to communicate it, how we describe it, may different quite a lot. But this, in the Chinese mentality, these three different, important figures all coexist together, and that are one of the reasons why Chinese culture is so rich and so deep and so profound. So this attempt is to start from the aging and try to do something quite different, because what we have in Europe is based on the solide and oral l'Acupunture Chinese. This text from 1934 has been probably the most influential text, and has brought to us the energetic approach to Chinese medicine. And in my opinion, this is an important part, of course, of Chinese philosophy and Chinese way of looking at the body, health, nature. I also practice this kind of disciplines. I have, really a deep interest in Tai Chi meditation. So I found this aspect very interesting. My opinion, this is not the whole story. So reading the Li Shu has brought me to many kind of, insight and interesting discoveries that I want to share with you today. So this text, of course, we don't have an original manuscript. We just found the oldest original manuscript we found of Chinese medicine come from this tomb in the modern way. And it's a couple of texts that are based on, we have just 11 meridians and are mostly based on moxibustion. So this kind of text is probably a rewriting happened during this period, the warring states, and its exact origin is not clear. Some legendary sources place this at almost 3,000 years before Christ. What we know is this, the manuscript the later re-elaboration of this text is at least 2,500 years old. So we're talking about quite a long time ago. Okay. So when we start, in order to make this kind of text digestible for a modern, palate, we would say. In chapter 12, we have a really key statement. As I was taught, Chinese medicine is all about energetic meridians, invisible lines, and mysterious qi floating in the body. What we read in the Ling Shu, which really is the fundamental text for Chinese medicine, is that once one person dies, it might be dissected to observe his interior appearance. And we can also discover the conduit, the vessels that we taught, the Jinmai, that we talk about in Chinese medicine, transmit much blood and little qi, or little blood and much qi. And one lower object contains much blood and qi, or little blood and little qi. The text says that all of this can be quantified. So we're talking about something that they were trying to quantify and understand. Again, this can be just a mistake. But if we go chapter 47, we have a thorough description, and this goes for each organ, talking about how one person died. We can look at his interior, and we can make some conclusion based on the aspect of the internal organs of the body. We can also say that if the liver is small, there is some kind of implication. If the liver is big, it's another story. That people with a wide chest may have an elevated liver, while a narrow chest, the liver may be sunken down. So the question is, how much experience, how long does it take in order to create a system in which you can infer by looking at a person which is its internal organ status or appearance? It's a really interesting question. So they do not only talk about anatomy, they seem to have quite a deep understanding about internal organs and also how to correlate it with the external experience of one person in order to diagnose illnesses. Go. And again, so when we talk about Frank Fu, we also have this kind of, esoterical understanding of them, and we see that they understood organs pretty well. And so the other aspect is channels, meridians, what we call meridians. What the Ling Shu has to say about this? Chapter 10 says they extend hidden in the parting of the flesh between muscles, and usually they can't be seen. But another statement says, where they normally can be seen, that is where the foot major in crosses the interior knot. So they also say that these vessels, surprise, can be seen from the exterior. And this poses a really big problem. What are they talking about? What is that vessel that goes between partition of the flesh and can be sometimes seen in the internal part of the ankle? So I had a video that showed something like this, but however, it would take too much. And again, they say that usually the channels can be seen because they lie, there are just some few exceptions. But then they say, when the six convict vessel and the vessel that can be seen, that can be actually seen, we call them luo. So the another concept important in Chinese medicine. And they say that especially if they can be seen in the back of the hand, between the fingers, raising from the dorsum of the hand and joining in the elbow. So again, we seem to have references to actual structures. And of course, if you see your arms, you can see the vessels, you can see the veins, you know, all the reticulum of the veins on the back of the hand converging up to the elbow. And again, they say that the upper parts and lower parts meet with each other, and the conduits and network vessels, both the deep and superficial vessels, they form like a circle without beginning and end. So again, this resembles a lot the vascular system. This resembles a lot the circulation of blood in the body. This resembles a lot important structure that brings actual blood through the body. And just to say, it's not something to be dismissed, because we reached that understanding also in the 16th century. We didn't understand that blood was circulating inside the body continuously, just not up to the 16th century. So to add that written in a text that is so old is something really important to consider. And then we have Qi, the most mysterious of the words and the most, of course, fascinating also aspect of Chinese medicine. We are said to work with the invisible Qi, of course, when we practice acupuncture. I had the utmost respect for this aspect of Chinese culture, and of course, I think that the spiritual or esoteric part has a deep place in Chinese philosophy. Of course, maybe, you know, weekend workshops are not the best way to teach and transmit this kind of knowledge. And of course, in the medical field, it's not something we can discuss easily about. So I think that it's more useful maybe to create a bridge between these two cultures, to stick to, you know, real definition that we find in this interesting medical book. And of course, the understanding about Qi as energy is a modern one. We as Europeans invented it. And now it's present in the dictionary, but it wasn't until, you know, a few years ago. So what can they possibly refer to in this text? Because they talk about Qi. And one of the translation original from the dictionary is that Qi can be intended as variable, a liquid, a fluid, or gaseous fluid, something that holds both the characteristic of vapor and fluid. Also, the ideogram shows a grain of rice cooking and emanating this kind of vapors. This is usually understood as something that we can take our energy from. If we eat and we breathe, that are the two constituents of our postnatal Qi, we say, the things that keeps us alive after we are off. But what they say, the name Shu, they say that when the upper bundle, the upper part of the body after digesting foods, opens and lays this fluid, this something, pass to bring the flavors of what we eat. This is used to steam the skin, fill the body, moisten the body air, in the same way they say as mist and dew. We can see the dew in nature on the leaf, and we can see the dew on the human body. As if we go to the next slide, we can see the vapor and the mist in nature and coming out of the body. It's a nice picture, also a nice video if you will have the presentation link. We actually emit constantly this kind of vapors from our body. And they say that we refer to these vapors, these fluids, as chi. This is what we call chi. So it's something that we don't usually learn too much in acupuncture school, but in the traditional text there is a strong connection between chi and fluids. So strong that if we go along and they start, talking about blood, for example, and the different kind of chi, it is saying that if we start thinking about more just to have a physical reference to chi as fluids, we can see that many things make sense also. Because they say that the clear part of these fluids, the most nutritious fluid that we come from food, they go inside the vessel and they form the camp chi. While the turbid parts, the parts that are not so used to nourish the body, but are used to defend the body, they circulate around the vessel. And so they start distinguish these kind of fluids. The one that are inside, the nutritious one, and the one that are outside, the one that we use to defend the body. If we have insect stem cells, we suddenly swivel in the blade where we have been stunned. If something hits us, the fluids go out, to take care of the inflammation. So this action of the body is something real. It's linked to the fluid, and that's most of the indication that the ancient text says. And just one thing back, another important statement in chapter 18 is that they say when somebody has lost his blood, he has no sweat. If we lose the blood, we can't sweat. So we can emit the chi, the fluids outside. When someone loses all sweat, if we lose our fluid, he has no more blood, he said. So this thing, fluid outside the body and inside the vessel, blood, are very closely linked to each other. And they state in the text. The fact is, in life, man has two things that may cause him to die if he loses sweat, fluids, or blood, but doesn't have two things that keeps him alive, saying that it's the same thing in different focus. And again, we can talk about, the external part of fluid circulating as being more turbid. We see that lymphatic fluids are actually really turbid in comparison to the fluid that is inside the vessel, that when we die, we can imagine that they could observe inside the vessel the blood separating in its solid part and fluidic part. So that way we're talking, we dissect the body, we see within the blood, in the vessels, we can see blood and chi, how much blood and how much chi. Maybe we can be talking about this kind of phenomenon, the separation between fluids and the corpuscular part of the blood. Okay, so if we go on, and we can also think about, are we talking about real blood when the Chinese talk about blood? And they say that, yes, it can be dangerous to mess with blood, because if you go to pillage the blood, you can also end one patient's life. If we go too strong on the vessel, it can be dangerous for the patient's life. And for example, they say, if you middle this acupoint, the bully point, the chi and the blood arrive 5 times, and then they are exhausted and the patient dies. So I was tremendously scared, because I was living in this point for a long time on patients, because in other side of acupuncture, we use a lot also to treat back pain. In the thumb side acupuncture, there are 3 points on the arm that go straight to the bone to treat, the back. So when I read this, I thought, oh my God, I made a mess. Probably I should have had that, but all the patients were alive. So I start thinking, what were they really talking about? And many authors say that this point must not be needed at any cost. In the commentators of the Lim Shu say this. And then I thought about, but it's probably because something has happened. Is this the only point that is called in this way, bully? Because there is a short bully, which is on the heart, but there is another one. And the next one is, it's zuri. It's striking on the femoral artery. So we can think that probably what we were talking about is careful where they go around big vessels, because if you go too deep and you puncture actually the femoral artery, they didn't have the needles that we had. Mostly acupuncture was using stones to make bleeding. So this can be actually a dangerous matter in practice. So they start making sense. Some points are forbidden not because of some strange esoteric interaction, but if you meet this kind of space, you can be in really dangerous. And so that's the point, because anciently, before the Ling Shu, there were many practices linked to acupuncture that use scone needles. So the Yellow Emperor says in chapter first that the scope of this book is to make people safe, to make so that they do not have to record to pointed stones, but they can use fine needles. So we start using the needles connects to the leak shoe. This was a movement trying to go from moxibustion and stone, bleeding to the use of needles. And so that's where we become really interested in the field of urology, because every tool in my opinion serves a purpose. We don't have just one needle, of course, in the Chinese medicine. We have colleague of mine had collected all these 54 at least different kind of needles that were used through medical history. But the one that, of course, we use the most, the fine needles, can be used to serve a particular purpose. There are, of course, it is to stimulate an appetite, you will say, because we had an acupuncture needle, we put it in the acupuncture point. The problem is, what is really an acupuncture point? Which structure are we targeting? And there are, of course, many different opinions. All of that may be valid. One, for me, is very convincing, because if you try to look at the acupuncture maps and superimpose it to the peripheral nervous system, you find almost a 100% match between what? An acupuncture point and some points, like you can see the kidney channel. This is an amazing work from Pony Chan, which is a Canadian doctor, Chinese doctor, that has made many dissections, starting the ring shoe and trying to connect it to modern anatomy. You can see the kidney channel and all these points superimposed to the posterior tibial nerve. And you can see that kidney 3 is just on the main trunk, and 4, 5, and 6 are 3 points so close to each other, but each one of that has a specific target, which is a different branch of this nerve, of course, the calcaneal, the medial, and lateral plantar nerves. All of that can be addressed with a specific acupuncture product with different function, sensitive different function, different motor function. So this is a really interesting application. And if we look at the chapter, the 13th chapter, which is my favorite because I'm working on it, I made picture on it because it's about senior channel and muscular and tendons. And we can see that in many parts of these chapters, we see, for example, reading about the chapter 13, the foot Shoyan, they say really interesting things about also that shows the certain neurological understanding of the body. We can see, for example, when you talk about the Shoyan that go on the lateral side of the skull, that if the table on the left is damaged, the right foot and the arm cannot be moved. So this shows an understanding of the crossing of the nervous system and the control that the left part has on the right side and vice versa. And this, of course, is also something that we as Western people acquired in the 16th century. So it's really impressive to have that kind of acute observation of reality and medicine in that book. Okay? Well, for example, when we talk about the hustle or the face, the Yang Ming channel, we also see that this musculature has a deep arteries that goes right behind the ear, and we will see what this can mean. And if we go again, when we see the pathology of the ALIMI on the muscles of the face, we find a fantastic description of the Bell's palsy, which is also something that has been described also by Charles Bell, which lived in the 17th, 18th century. So it's the first probably description of a neurological condition in a 2,500-year-old book. So it's something impressive. And of course, the description is that all of a sudden the mouth is lengthened, the eyes falls to close. All that we know is when the facial nerve is damaged. But they link this musculature to a branch that go beyond the ear, which is the exact pathway of the facial nerve. Okay. And when we talk about, for example, the TIANJUN, the F TIANJUN, also they connected. It goes in the ulnar to the olepharon. They say if you pluck the senior channel in this position, you can feel it on the little finger. So this is exactly the reaction that you have when you struck your elbow under something and you feel pain in the finger because you have just hit the ulnar nerve. And so, of course, you can push something imaginary as an imaginary meridian, but you cannot pluck, you cannot, use it as a strain if it's not something in theory. Okay. And of course, also the Tianjun senior channel has something, but we can go off this becomes too. So, the scope of my description is, of course, highlighting these anatomical references and trying to put it all together. So the question is why, if they are talking about vessels and nerves, why they seem so different from our description, understanding, pictures of the vascular and nervous system? And this is a good question. So for me, this comes from the fundamental difference between the approach to the body. This is what I call that we saw usually we study a theater. This is the anatomical theater in my city, Bologna, which is amazing. It's one of the first anatomical theater in Italy and probably Europe, probably also in the world. We started to study anatomy, dissecting dead bodies. But what they really were interested into were how the body reacts and moves and when the person is still alive. So they try to look at body with a different perspective. They were not interested in, so much in the singular of us vessels and nerves. They were interested in something that we can see on the right. What do we see here? It's a neurological condition. It's the opistotonus in a patient which is affected by PELONI. And this highlights something, that something is activating all at the same time. If we see he's arching his neck, he's arching his back, he's arching back his hips, he's even arching all his toes. So he's activating movement. We can go. If we study right, we must study motion. And what is important in motion that has come to really interesting modern study are muscle chains. And these muscle chains make an organized movement of the body. We don't move using one nerve at a time, one muscle at a time. We move using complex schemes of orientation into space. So we can move back, we can move forward, we can twist. So our software works trying to organize the movement in a more cheap and less expensive way. And so this anatomical structure and functional chain are really key to the understanding of the human body, the human movement, and also Chinese medicine. Because there are a few systems in the body that have this characteristic. We talk about holistic medicine. We can talk about holographic system that if isolated, reproduce the whole body to its smallest detail. And this is the neurological system we talk about, the vascular system, and the third one is the fascial system, which is a really recent discovery. We are starting to study and understanding it. But this kind of organizing the body, I worked with the Stecco family, which is in Padova, based in Padova. They made a lot of amazing work on fascia, rehabilitation and movement. And they have come up to the same exact system that Chinese medicine has come to. The organization into 12 different structural and fascial chains. So we can say this way of organizing the body, we can go on, is something that is present in the English book. They talk about in this chapter, the senior channels are exactly the description of how each muscle is connected to the other in myofascial chains that pertains to movement on the back, the front, twisting, etc. So it's also our drawings that we are trying. We will try to publish at the end of this year. It's a book that I'm making the pictures, not the drawings, on the senior channels. So it's currently the anatomy of the senior channels in a modern perspective. We can go on, okay? And then if we see the main channel, we can see that each point is precisely assigned to a different nerve. We can go on. And for example, also on the bladder, we have this organization of the posterior back line of the body, the muscular posterior chain, and we have all the points from the main meridian that are exactly aligned on this chain. So we have anatomical understanding of movement, we have a senior channel that organizes this movement, and we have the main channel that can work on, for example, the aspect of movement. We can simulate by the acupuncture points each of the muscles that are endowed in this myofascial chain. Not only if we see how the most difficult part is the trunk, but if you look at how the thoracic nerve exit from the spine, you can see that it's true. We studied by metamers in this way. We section the body horizontally. But you can see that each of the nerve gives a branch to the back, to the side, and to the front. Okay? So when we try to move ourselves, and like we see in tetanus or we see in athletes, we kind to go back. We don't activate just one root. We activate all the fibers that go to the posterior chain of all the roots of the spine. So the program of movements goes by Chinese sinew channels, by vertical line, not horizontal. So that's the way they organize the body. And they describe the nerves and the vessels that were running in these spaces. Okay. And if we say, just one small piece, if you say these are the points of the bladder channel, you can see the internal chain and the external chain. If you see this root connects directly to this small structure near the spine, which are the autonomic ganglia, the sympathetic ganglia, the autonomic nervous system ganglia, from stimulating the root of the spine, you can have access also not only to the muscular system, but also to the vascular autonomic nervous system. And this is something they knew very well about, because if you see in the next slide, all those that we study as the shoe points on the back, every point of the back, depending on the level in which they use stimulate, can be a direct access to an organ, to a viscera. So they have this complex system and understanding on how the body works and where to stimulate it in order to obtain a reaction in the body. And if we can analyze the main bladder channel, you see when you go in the sacrum, you have the 4 yaw points that are exactly on the sacral foramen. If you go to the points 54, 53, you go on the gluteal nerves, you go on the sciatic nerve. If you go on, you can see that all the points that we don't really understand why they put 1 inch on left, on side, up and down, they match exactly how the nervous system divides itself peripherally to go to the posterior tibial nerve, tibialis anterior, and all the different branches of the sciatic nerve are perfectly guided by the other points. It's so out to the feet. So that's this concept of fascia, of course, is really interesting. I have studied quite a lot. I won't spend too much time on it, but the concept of Sanjiao that we have in Chinese medicine is probably something that is really connected to this idea of fascia. Because if we see that fascia is a system that they knew, and that was the unifying trait between the muscular, glandular, and nervous system, we can assume that they should have talked about it in the past. And of course, there is this concept, the triple ladder of Sanjiao, which also the ideogram is interesting because it's tree and jiao means it's something cooked and there's a bird on it. So somebody says that this kind of cooked skin is how the fascia looks like when you first set it. Yeah, chicken, and of course it's not maybe a big whatever, but that's a concept that Chinese had. The Sanjiao was everywhere, they say, but had no form. But because it was that, was organizing all the other structure. And moreover, they say that inside the structure, the fluids were running through and circulating. So this, another system, really interesting, that has been studied by, Chinese medicine really deeply and thoroughly. So we can go, and there are, of course, modern studies also that points in this direction, where they've tried to stimulate acupoints and see effects if you stimulate with light, with sound waves, and they found that there are some, less resistant channels that match the description also of the acupuncture channels. And sometimes this structure can become visible when, even during illnesses, if some pathogen has to spread across the body, sometimes it takes the exact route that the Chinese, pericardium channel will be represented as. So there are spaces inside the body that are organized, the vital structures, nerves, the vessels, and the muscles. And this way of looking at the body is probably the treasure of Chinese medicine. An integrated way of looking at the body in the way it moves, in the way it stores vessel, nerves, and the way these vessels and nerves are connected to the internal organs of the body. So if we have to conclude this presentation, also I put you this Libre study when they study also the circulation of fluid around vessels. And it was interesting to me because we all struggle a bit with circulation of chi in the bottom, because they say that one meridian goes one way, then one goes at the other. Then if we see the ancient texts, all the meridian was from the periphery to the center. So there are quite conflicting ideas of circulation. But modern models are pointing in some interesting direction, in which beside the flow of blood from the center, from the heart to the periphery and back, there is also another circulation similar to the lymphatic, but different. They go from all the vessel from the periphery to the center. So this makes sense to the concept that we have of the shoe points of these kind of readers that starts from the periphery and goes and become bigger as they go to the center. So just to conclude, of course, it's been quite a journey through different parts of the book. My, take-home messages or suggestion, because I don't feel in charge of the truth. This is a suggestion and an idea interesting ideas to reflect upon. But probably the acupuncture have organized the body in these 12 sediments aligned with facial movement plates, basically. And the senior channel correspond to these tendinomuscular chains that facilitate and coordinate this movement. The primary acupuncture channel align also with the main vessels circulating nutrition chi, yin chi, and also wei chi, defensive chi, through the body. Acupuncture can modulate the physiological function of the body, stimulating what? Probably the nervous system. The invention of the needle was something that you can use to go deep in the body, stimulate the fascial system by twisting, lifting, in order to have an effect on the nerve without damaging the nerve, being close to the nerve enough to add a stimulation with the needle in order to affect the physiology of the body. In which way? It depends on the points, on the technique you used, and you can accomplish a different variety of function. For example, oxybution increases the blood flow. Blood letting decreases, make the vessel contrast. Acupuncture is a perfect tool to modulate the nervous system and make it bounce. And then, this is probably something that we are not used to in Western acupuncture, is to look at, the hidden part of things. And what we can take from the Lao De Jing, which is another Taoist book, is that, of course, we can study and focus on the vessels that are made of clay. But what makes them really useful is the emptiness that is inside the vessel. So, what is interesting in this kind of medicine that studies not just the structures, but also the spaces and the structure that organize the whole body. And so I hope that this can kind of, insight can be really useful and integrate to our, modern medicine and way of looking at the body. And that's it.
Now, we could move in order Cecilia and Cinti here with us today, a key figure when it comes to neuro-acupuncture.
Thank you, first of all, to EOC and to the Neuro Cantonale who hosted us today, who hosted our idea and our practice that is very helpful to medicine, but of course we need to do all the path to enter in the medicine and to be involved in the clinical and the research methodology of the modern medicine. So thank to them, to the Neurocentro, thank to Massimo Bella and to Scuola Tao, thank to Giuseppe PELONI, that is the head of the integration here in the hospital in Swiss, because our idea is that today we have the method to really introduce acupuncture in medicine, and this method is Neuro-acupuncture. I will do my speech about the method. Is not very interesting, of course, but for medicine method is very important because leads us to medicine. The other leads us, of course, to the healing of the patient, but of course the hospital needs method. So me with Ami, the association of founders, we work in the real integration, and we think that Neuro-acupuncture can be a real tool. Our mission, let's say, is the 3-point awareness about acupuncture, what we can do with acupuncture in medical doctor and in general population, of course. Best practice, because each clinic has different best practice also in acupuncture. So we have to know it and to be able to apply it. And clinical use, there are very, very new clinics like neurology, like sports medicine, like aesthetic medicine, new clinic where we can see the difference if the patient is treated with reflex medicine as well, with the Western medicine. So why Neuro-acupuncture? Because Neuro-acupuncture is already a systematic medicine, and I will show you why it's already systematic. Second, we will speak about the definition that we are working with all these masters in these years. The benefits of the definition that we desperately need to insert some very active technique taken from acupuncture in medicine. The history in East and West, that also a history of the research, and in particular of the European research that lead to this method today, that can be applied to all acupuncture to have this method worldwide spread. And I will show you why. It's a very not well-known history that reflects medicine in Europe. So let's go on. Acupuncture born officially in the 30s when we all over the world everybody started to see acupuncture in the light of neurophysiology and neuroscience. And today we have techniques that are very easy to learn, with a very strong neurobiological rationale, with a very high standardization, very low cost, very high efficacy, and applicable also in severe disease. We speak about fungal pain, Parkinson's disease, aphasia, swallowing disorder, post-concussion syndrome, neurosurgical counts, post-stroke related syndrome, neglect, diplopia, every kind of difficult disease that we have in Western medicine. So what's best that integrate the two sides of the world to have the best medicine for our patient. And reflex medicine, acupuncture, show us how to go from a complementary medicine, a traditional medicine, or an integrated medicine, of course, to an etiological medicine. So something that can really treat the physiopathology of the disease, like the Chinese say to us, to treat not just the flowers of the disease, but also the root of the disease. So this etiological medicine could be the really new things about neuro-acupuncture. Acupuncture, of course, we know that is the medicine that has more activity on nervous system. So this etiological medicine on nervous system can bring many different outcomes. So acupuncture, neuro-acupuncture has its own history, its own method of research, and its own clinic. So it's a systematic medicine already, and you have to use it now, from today, from tomorrow in our career, because it's immediately integrable in the Western medicine without the need of further cultural mediation, because it's already started, and I will show you. And it's very easy to insert not only in clinical practice, but in medical thought, that is much more important, because the technique has to follow the medical thought. This term is also widely used. For example, if you do scalp agopunture, they say neuro-acupuncture. If you do motor point agopunture, they say neuro-acupuncture, because everybody is using this term to define something adapted from the ancient text to the modern medicine. So we know from the literature, this is British Medical Journal, that despite the massive research, acupuncture has not the real integration and the real awareness that deserves this massive literature. So we have to focus on the method. Just for show you, this 2026, in January, we had 50,000 results in PubMed about acupuncture. Now, last week, 51,000 results. So you see the growth is logarithmic of this study about acupuncture. So we need to bring all this study to the clinic and the real patient, no? And so we have to identify how we can improve our method, because with this method, of course, we are not able to arrive to the patient to we are all the time something that the patient itself choose, not that the medical doctor or the clinical part choose for him. Go, please. So when we see the epistemology, the theoretical science, we see that method is something that you have to establish to acquire knowledge and to interpret the knowledge that you have acquired. So it's important as the result itself, and I think most important is that when you have a method, you can improve your method to the different patient. When you don't have a method, you have to trust the protocol, and the protocol is not tailored to the patient that you are seeing. So this is a conundrum that we have to solve. And but a technique can be fully studied once we have established a method and a mechanism of action. So these two characteristic features established, if I can speak about the medicine, and the neuro-acupuncture already fulfill this criteria. There is no need of more study to fulfill this criteria. So we have to know it in Europe, and we have to start applying it. So that's why ALIMI, our association, promoted this worldwide dialogue between different Scalp school, our French Auriculotherapy school, different other school I will show you, to promote this cultural advancement, to everybody be aware of this method. Avanti. Come dice, noi siamo. Neuro-acupuncture has already overcome the major issue of acupuncture research. For example, the anatomical target is well defined. Here, as the same, the nerve, the structure, the scalp, the target is very defined and is homogeneous. So it's not one in the foot, one in the ear with so different nerve. Everything is already studied homogeneously in different techniques. The stimulation technique is codified. We have an immediate cause-effect relationship, so we can study really the technique and not after 10 treatment. And there is, most important, a method for point selection. That brings us to the problem, the major problem of acupuncture, that you don't have a Western rationale to choose the point. Neuro-acupuncture gives us a rationale that is consistent with medical thought and allow a dynamic protocol for a dynamic research. So I can adapt the protocol to different patients and different stage of the disease. Of course, also in aphasia has different stage, and every patient is different. So we have to tailor this treatment to have the result in the study, like the result we have in our clinic. So we started with Tianjun Wang in London, and Jason Howe, this journey, this adventure that brings us here today in Lugano, for definition. And we choose this definition, of course, we can speak about, but standardized acupuncture neuroactive technique, revised in the light of neuroscience, combined to improve the significance of the stimulus, and in collaboration with functional rehabilitation. Of course, we can study this technique one and the other without combining, but of course, to have results in very, very severe neurological disorder, we have to combine it to improve the significance of our stimuli. What are these techniques? For example, different kinds of scalp Agopuntura, French Neuro-acupuncture, because give us a strong rationale, as we will see about with Dr. David ALIMI. And for example, motor point acupuncture, Sinao Kaishao technique, I don't know if you know about, is a very strong stimulation, neuro-rehabilitation with the acupuncture that is very standardized and very well divided from point when you stimulate the nerve trunk, point where you relax some muscles. So it's very well standardized and very easy to learn, of course, because it's standardized. And this combination at a different level of nervous system, of course, if we use a point in the cranial nerve, we act in some part of the brain. If we do a trunk nerve distal stimulation, we do other level of stimulation. So all this level brings a very, very big neurobiological stimulus. And with functional rehabilitation, I think that in the West we have also to rethink our rehabilitation and to take an example from the Chinese, who they does much more neurofunctional rehabilitation, and then something that we have to acquire, I think also. I will not go in the detail today because it's the longer, but we need to acquire their method because it's much useful for the patient. So, Neuro-acupuncture gives us a real theoretical and clinical integration. For example, is extremely effective, is cheap, is feasible in a chair. You can sit in a chair and you can do it. So, has no side effects. So the clinical impact can be massive. Is important in research because treatments are standardized, repeatable, adaptable to different patients, tailored to different diseases. So it's very strong, both from the mechanism of action point of view and clinical methodology point of view. So it's very important, as Dr. Kim said us, the first point are these two. And well studied, of course. And in medicine, there is the third level that give us, to our Western medicine, something that we don't have, a tool to treat the nervous system. So, force us to rethink also neurology and Western neurology, I think, in my point of view. So the challenge is today to develop a sustainable method of institutionalization in the hospital, in the rehabilitation clinic, in all the real medicine setting to arrive to this patient, this neurological patient. So, treatable condition, for example, multiple sclerosis, cerebral palsy, also hearing loss, dizziness, vertigo, very different kind of disease that has in common the nervous system at the base of the disease. So for us it's very interesting, let's say, no? And easy to learn, But the most important thing I want to highlight of this is that we think, thanks to neuro-acupuncture, we can think about total recovery from neurological disease. For us in West is a sort of paradise to think about neurological disease solvable. And for Chinese, if you are able to arrive at the first stage of the disease, if you are able, you can really change the life of the patient, and you can really rethink about neurology. For example, behavioral sequela of stroke. Very different kind of symptom that we think will be not solvable. They will solve it in a very short time. For example, epilepsy post-stroke, behavioral vascular epilepsy, the state of consciousness. Tomorrow we will speak about the acute stage, because it's very important to understand that this technique applied in acute stage that they can lead us to the full recovery of the conscience of the patient immediately sometimes, also in vegetative state patients. So it's very important that I conduct all this experimentation to see with my eyes what the Chinese are telling us from 50 years, no? So, my personal thinking is that if more you are aware of physiological mechanism of action, more the usage and the appropriateness of the usage of acupuncture will grow, because a medical doctor, to apply a technique in a real medical context, in a real emergency, has to be aware of what you are doing to the patient, not just something you have to learn about another medical doctor. So you have to be focused, and appropriate care is the right treatment provided from the right providers, at the right patient, in the right place, and at the right time, no? To have the most of the treatment. So acupuncture and neuro-acupuncture, these words are very important for me to understand. Why we are doing all this on neuro-acupuncture, why we are all working on this item with Giuseppe, with Massimo, giving so many energy to this project. The history in East and West is very interesting, because we are used to think about reflex medicine something Asian, but it's not, because we have in our medicine, these are all medieval texts from Italy. There are some in England, some in ancient book library, and they use this treatment. If you see this book, I saw something, I'm not a epigraphist, but most of the indications are the same of the acupuncture point. For example, chest disease or asthma, for example, you see the middle treatment is a treatment that we can do also today for asthma patients. Go on. And this, let's start from the research in China, where from the 1930, they start to study like us, looking at the neuroscience and modern medicine. So these are the main research direction. There are some neuro-anatomical approach. So focusing on the real anatomical target, real anatomical physiology, neurophysiology of the point, the real nerve, the receptor. Once the physiological approach, so take all treatment and stress this to arrive to new results, like Sinao-Kai-Shao technique, but there are many other, like Sungchol technique, for example, and neurofunctional approach, so new biological model applied to acupuncture, like French auriculotherapy. So a model that is the one of the somatotopy, a theoretical model that is applied to the medicine. for example, motor point agopunture. We choose the placca motoria, placca, the plate of the muscle, and we treat all them. So it's a new biological model applied to agopunture. There are several, and it's very interesting. For example, Scalp agopunture, we establish the cortical area and over the needle, and we can, it's not the object of today, all the study of the mechanism of action that we can do with this approach. This is a little bit of history, just for you to understand how much was studied agopunture in West. First of all, we can say that electro-agopunture was invented in Paris, 1830, from Jean Lopez, was a surgeon in a hospital of Paris who published more than 300 cases of sciatic pain treated with electro-agopunture in Paris. So it's pretty long history. And for example, let's do another example. Melzack, in the book where he speaks about the gate control theory, in the first page of the book, there is an ancient Chinese with meridians, because he was able to witness a surgery with acupuncture anesthesiology, and he think about the gate control theory. So, like this, for example, Pavlov had an acupuncturist in his cabinet when he said every stimulus can be conditioning, because he saw acupuncture. So the history is very important, and we do in our association a full history to understand. For example, I think, for example, the auriculotherapy that is very, very well standardized and could be our guideline to standardize acupuncture. From this is the reflexology, let's say, was the form of acupuncture that we had in West. So something mechanical that do something non-mechanical. For example, we have this history that from the medieval time, this is Padova, Bartolomeo Squarcialupi, from Antonio Valsalva, 77. He was the first book on ear that he in this map, page 3, he put a point with a sign that says, this is the point that everybody uses for dental anesthesiologists. So 77. That's the reflexology. So from that time, acupuncture arrived in Europe around the half of the 17th century, and then was pretty much studied, and then arrived many different reflexotherapy. In this book, for example, Alberto de Renz make some a catalog of all the reflexotherapy: nasal centrotherapy, auriculotherapy, acupuncture, vertebrotherapy, the reflex of vertebral. So there are very interesting also for today. And in 78, Jean Bossier, femoral acupuncturist, he was the head of Montpellier anatomic facility of the hospital. He made this book, Neurobiological Basis of Psychotherapy, that is today, for me, the reference for this kind of work. This is the first, in Italy, of course, we are all the time the first and the last in the same time. So also in Agopuntura was the first in Europe. The first Chinese arrived with priests in Naples. They do the College of Chinese. This is a very famous holy family of Chinese, a church that was made in Naples. And this church was very close to the hospital of Untreatable, a famous hospital in Naples, where the doctor started to do acupuncture. And in 1830, in Naples, there was the first public acupuncture cabinet of the world, I think. Because I don't know if in China there were public acupuncture cabinet practice, I don't know. In Italy there was in this year, so it's very interesting this. And also the University of Naples is called the Orientale, because of this very strong connection with China. So it's an interesting story. And at the time, Vincenzo Coppola was the head of this service, was thinking about nerves. And also, if we study these texts, we understand that many doctors at the time used acupuncture to understand that nerve wasn't something that brings a liquid, but something that the nerveo liquid they called, but something that brings electricity. So it was important also at the time. Go on, please. This is our story about acupuncture, and we found the first neurological case reported of acupuncture. Is 1825, generalized epileptic seizure for 5 days with trisma. All the cases, of course, redacted, but it's interesting. The outcome was a wonder, because with just one needle, the patient regained the consciousness. So it's very interesting to see that one of the first applications of acupuncture was neurology. And you find in all this book, the doctor say, this is very suitable for neurological disorder. What? This was the first course in University course in Europe, in Italy in 71. It was called reflexotherapy and auriculotherapy, because at the time there was standardized acupuncture, reflexotherapy, acupuncture and auriculotherapy. To put acupuncture under this Western reflexotherapy. This is the first article published in English and in Italian, of course, about neuro-acupuncture, 76. But for the Italian, for the neuro-rehabilitator, I just for you to point out that Grimaldi and Perfetti, there are two of the most renowned doctors for neuro-rehabilitation, were in this team studying acupuncture. And the result, discussion, constant and often clinically impressive, make any discussion on the validity of the method superfluous. That's the word of Gomirato, who was the head of physiology of Pisa. He was a very, very big doctor in Italy. These two big father of the neurorehabilitation and the acupuncturist. And it's interesting because they proposed the bulbar level at first side of integration. So they discussed neurophysiology, and they did both the article, one clinical result and one neurophysiological consideration, because the two things in neuroacupuncture have to be side by side. Because if you see a miracle, there are two possibilities: or there is a miracle, or there is a neurophysiological path. So we have to stay in the neurophysiology to don't claim to the miracle, no? And that's the only way. This is the history of the auriculotherapy. Professor, I put you there because you are the last in the history and the first of the new history of acupuncture medicine. And you see from some point to a study, anatomical study, to the magnetic functional resonance that demonstrated that a somatic stimulation of the thumb has the same cortical effect of stimulation of the thumb point in the ear. So very interesting to notice all these. This is an epic legend of the auriculotherapy. Go on, please. And we all these methods give us the theoretical base of somatotopy. Because if we go to the medical doctor and say, oh, you know, the body is holographic, and the medical doctor, of course, say to you, yes, it's holographic, but now I cut you a hand because it's gangrene, no? Because medicine is something that you have to be able to actualize and to focus with anatomy and blood and nerve. And so all this work of French auriculotherapy give us thanks to a particular elevation of the ear, a particular surface, of course, is so small, 21 centimeters square, and a specific receptor, a specific and well-studied embryological development, how we can not just have a neuromodulation, but we can change the image of the disease in the brain. It's not a modulation of the nerve up and down to have, for example, if you don't swallow, I stimulate you swallowing and you do it. It's changing the brain, the image of the disease. So the brain answer with a treatment is on its own. So on. With not just neuromodulation, but specific effect. And we, of course, I will not speak about it because we will have to do a whole year, but there are some features like the spatial organization of the nerves, some nerves that can conduct in both directions, the geometry of the brain, the homeopathy, and that's why in this work we need to involve the European reflexology and French auriculotherapy, because it's the only technique that focuses on how this geometric structure arrives to the skin and brings to the skin the whole machine of the brain to the skin where we can actually treat it. So it's very important, because if the appearance of the treatment is simple, so could deceived, but you know, nature is simple and it's very complicated. So we need to be aware of what is under this simplicity that we see. The very structure of the brain is done with this geometry. So for me, for our work, is very important to bring together this community of people working in neurological disorder to understand how this map unrolled on the body is structured. For example, many schools of acupuncture use the meridian itself like somatotopy. So we have to understand why, for example, in Qing school, abdominal acupuncture, hand acupuncture, choreo hand, or SUNGCHOL, many different techniques in the world focus on this principle. So we have to be able to explain it, to study it, and to bring it in the future of the medicine. So European reflexology for me also it is not big, of course, like Chinese experience and clinical experience. Is very important to bring us in the physiology and not just in the clinical analysis of a technique, because acupuncture is not a technique, but is a medicine. Without the physiology, we are in the technique. With the physiology, we enter in the medicine and we can actually work on patient. Last thing I want to do is speak to you about what we can really achieve with this technique. I have this service in Siena with a neurodevelopmental disorder child, and we treat genetic condition, metabolic condition, hypoxic condition, autistic, HAD disorder, premature child, stroke survival child, stroke survival in belly stroke, or we have old age not just small children, of course. We have the older was 50 years old, 50, tetraplegic child spasticity, and all these cases we treat in Siena, they all go beyond the expected. That's why, of course, newspaper, everybody is interested, because they go beyond the expected. This is a free clinic. Of course, we just want to have the casuistic, the cases, the technique, to refine the technique, is not something we do for money, of course. But we can see really the life change. We can see the child totally vegetable, let's say, arrive a new life, and they go to school and they're able to speak, to run with the other child. It's so impressive that we need to see it, because if you don't see, the reaction is all the time the same. Oh, wonder. That's why we do this. That's why we have so many persons following us here. I'm very happy to see so many people, and I'm very happy to see online people from all over the world joining us in this study. Because when you see it, of course, you want to do it, and you can do it very, very easily. As Dr. ALIMI will say to you, or Dr. TIANJUN will say to you, most of the time, 3 needles can change a life. It's strange, but can happen. So enjoy our master. Thank you very much to all of you for the support and the study that we go on. And thank you.
I just would like to say that at the Italian journey of Neuro-acupuncture, this year we started an international forum. This year there were 18 acupuncturists, doctors, professors all over the world sharing their experience, because of course it's very important to have a network of people that and so the invite is to go on with this initiative.
Reach us, share your results, share your need, and we want to do a revolution.
Voilà, je vais vous expliquer ce qu'est la neuro-auriculothérapie. Voilà, donc c'est la neuro-auriculothérapie, l'acupuncture auriculaire ou auriculothérapie. Tout ça, ce sont des synonymes.
All of those words that you're seeing on the slides are synonyms.
Je vous ai fait un type historique, vous voyez. L'auriculothérapie remonte à la nuit des temps.
Auriculotherapy comes from very, very, very young.
Ça remonte à 3000 ans avant Jésus-Christ, à years, là-bas à gauche, 3000 ans avant Jésus-Christ, où certains mystiques recommandaient de soigner les maladies de l'hémicorps droit, en plori à la lettre hébraïque qui désigne l'oreille droite. L'oreille
Of the Hebrew letter that
en pensant à la lettre hébraïque
of the right,
désigne l'oreille droite.
the Hebrew letter that defines the right ear,
Et pareil pour le côté gauche.
and the same for the left side.
Voilà. Vous voyez, ça remonte à 3000 ans avant de l'art réel. Au IVe siècle avant Jésus-Christ, il y a Hippocrate. Il a beaucoup écrit sur des points de l'oreille. Sans en donner une quelconque signification. Describe many parts of the ears. Et il a été constaté que en activant, en stimulant certains points de l'oreille, eh bien, on arrivait à avoir des actions thérapeutiques.
Study observed that by stimulating a few points in the ears, he could obtain some therapeutic effects.
Hippocrate a écrit 70 ouvrages. 70 ouvrages.
He wrote 70 books.
C'est un vrai thésaurus. Et dans chacun de ces 70 ouvrages, il fait référence à certains points de l'oreille qu'on devait stimuler pour soigner telle ou telle affection.
In each of these books, he refers to certain points of the ears to treat such and such.
Au XIIIe siècle, les Turcs, le Turc recommandait de boursibuster en quelque sorte, de bosser à la limite de la brûlure, pas tout à fait la brûlure, mais elle laisse par sorte de la brûlure, certains coins de l'oreille,
Almost burning it, certain points of the ear,
pour soigner.
different pathology treats different pathologies.
Mais c'est un type enluminure qui vient là au XIIIe siècle. Au XIVe siècle, il y a un peintre flamand, vous avez Hieronymus Bosco, de son vrai nom Hieronymus Panaken, un peintre flamand, et qui a peint un triptyque qui est exposé au musée du Prado le jour en Espagne à Madrid, et on voit sur le panneau de droite, là ici, sur le panneau de droite, d'authentiques techniques
Of Auriculotherapy.
étonnantes. Et vous voyez, au XIVe siècle.
And the 14th century.
Et il y a un point notamment qui est désigné, qui est celui-là, qui est toujours utilisé, notamment aux des pathologies ophtalmologiques
Eye pathologies
et des pathologies, disons, pelviennes.
and spondylic pathologies.
Déjà, vous voyez. Alors il le faisait sans savoir. Son panneau décrit des petits diablotins. Vous voyez, des petits diablotins, la planidiale. La littérature s'appelle l'enfer érotico-musical.
The building is called LAUER, the hell.
Et on voit ces techniques d'auriculothérapie authentiques, déjà au XIVe siècle.
Auriculotherapy techniques on the
Au XVe siècle, les corsaires,
of the 15th century.
savaient symboliquement qui se cachaient à l'œil et Constazin le faisait, soit parce que malheureusement ils avaient crevé quand ils se battaient tout le temps, soit parce que en obstruant corollaire, neurophysiologiquement, automatiquement, on augmente l'acuité de l'autre.
Either
Il y a un switch, c'est ce que disaient ceux qui connaissent. On est appairé. Et
in order to increase acuity of the other eye.
la moitié du corps doit être appairée à l'autre moitié du corps,
The other side of the body
avec des proportions de 70-30 et inversement 65 de l'homme et donc quand on recule un œil, on porte automatiquement l'acuité de l'autre œil.
So if you go one eye, you have quickly the other eye.
Et en plus, ces corsaires avaient remarqué que en portant un anneau d'or, vous voyez, ce corsaire a un anneau là, à l'oreille. C'est de là l'origine de la boucle d'oreille.
Recording in progress.
L'origine des boucles d'oreilles que vous portez là, ce sont les corsaires. Pourquoi ils le faisaient? Parce que en se mettant un anneau d'oreille au centre du lobule de l'oreille, ici, ceci s'appelle le lobule, ça c'est le lobe. Souvent confond, ça c'est le lobe, ça c'est le lobule. En se mettant un anneau au centre du lobule, ils voyaient leur acuité visuelle augmenter de façon importante.
The vision equality.
Et du coup, ces corsaires faisaient de l'auriculothérapie sans savoir, finalement.
They named themselves auriculotherapy without knowing it.
Les points n'étaient besoin de transpercer le lobule de l'oreille d'un côté à l'autre. Je sais de cliquer, mais ils ne le savaient pas. En plus, ils faisaient une espèce de, je parle pour les auriculothérapies, c'est d'aller ça devant, ils te faisaient une double transfixion. Ils faisaient une double transfixion On utilise des techniques. Okay. Yes. Assume doesn't work. Okay.
So you have to do the phrasing practice and then it
Science. Okay. We're learning process. Bon, vous l'avez d'abord, sujet de la construction. Je faisais l'équivalent du double construction. Of the double construction. Ça consiste à mettre deux aiguilles en face à face, dans le même point, et de faire sur la technique propre à notre école. Face to face, opposite sides, deux aiguilles traversées, une de ces points latéraux médial, one from the outside to inside, et l'autre médiolatéral, diagonal from inside, dans le même point. Et ceci a une action thérapeutique très puissante.
This has a very powerful, very easy technique.
Et d'autres Écossais avaient adopté ces boucles d'oreilles pour augmenter leur acuité visuelle. Et c'est le même point qu'on utilise encore aujourd'hui, en 2025, en ophtalmologie.
So, the parrot used at the time these double transition techniques, a technique that we're still using right now, 21st century.
Et puis, il y a eu encore une grande historique, j'ai passé beaucoup. Au 19e siècle,
On 19th century,
en 1810, il y a un professeur de Parme qui s'appelle professeur Ignaz Scuola,
1810, Ignazio Colla,
qui avait décrit l'observation
who described that observation
d'un patient qui était arrivé à l'hôpital, il était à Parme,
who arrived at the hospital
et qui avait eu une paralysie de l'hélicorps opposé à la figure d'une guêpe.
Okay, let's try something.
Ce professeur avait reçu un patient
So, the professor received the patient
qui avait eu une hémiplégie
who had a half body
ou une héparésie ou une hémiparésie
or hemiparable,
ou une hémiparésie du côté opposé à une oreille qui avait été piquée par une guêpe.
on the other side of the ear, of the side of his body, his ear was stung by a wasp.
Voilà. Ce patient avait été piqué par une abeille, une guêpe,
So this patient was stung by a wasp or bee
et il avait présenté une hémiparésie
and presented
autorisée.
a hemiparesis.
Voilà. Et donc, personne n'avait rien compris. Et lorsqu'on a retiré le dard de la piqûre,
No one understood it, but when we withdrew the pointy part of the bee out the cerebral, the sting, yeah,
dans l'heure qui a suivi, ce patient récupérait sa motilité, il a récupéré totalement.
in the following hour, the patient recovered his
Voilà.
mobility.
Et c'est une observation remarquable d'auriculothérapie.
This is a remarkable observation or
Voilà. En 1850, un médecin corse s'appelle Luciani à Bastia
in 1850,
avait décrit Luciani à Bastia,
Dr. Luciani Bastia
avait décrit ce qui est devenu le voin corse,
described what had become the cursory.
Il stimulait cette partie de Félix, juste ici,
History that part is
là,
anti-hesics right there
pour soigner une sciatique résistante à tout.
to treat a sciatica that was multi-resistant to therapy.
Voilà. Et enfin, à la même époque, dans les années 1850, Duchesne de Boulogne, vous connaissez la phlebopathie de Duchesne de Boulogne, par exemple, c'est lui qui l'a découvert.
At the same time, you know the Duchenne analysis.
Et il avait fait la cartographie auriculaire du chien. La cartographie des points auriculaires du chien. Parce que realize mammifères,
Realize the cartography of dog's ear.
tous les mammifères ont une cartographie neuro-réflexe auriculaire. Tous les mammifères.
Because all mammals had a ear reflex cartography.
Sauf que l'oreille des mammifères ne représente pas le lobule, n'ont pas de lobule,
except that models don't have logos.
Et donc, toutes les représentations neurophysiologiques, neurothérapeutiques du obus sont reportées sur l'anticranius ici, chez ces mammifères.
Therefore, the antitravis is the location where these normally localized logos are reported.
Voilà. Vous voyez, il y a encore un historique très long, je l'ai bien décrit dans mon livre. Et vous voyez que
There's a long historical described in my book.
et cette connaissance est restée longtemps cachée.
So this knowledge has been hidden for a long time.
Elle se transmettait de bouche à oreille, de père en fils, de maître à disciple, un peu secrètement.
So this knowledge was transmitted from generation to generation, from master to disciple as a whole.
Vous avez les trois grands redécouvreurs des bases médicales de l'auriculothérapie qui sont Paul Nogier. Paul Nogier, c'est lui qui a redécouvert l'auriculothérapie, mais l'homologie remonte, vous l'avez dit, à la nuit des temps.
So here you have three new pioneers and architects of auriculotherapy, starting with Paul Nogier, who rediscovered, because I insist auriculotherapy is a knowledge coming from long time ago.
Alors, vous avez au milieu le professeur René Kovacs,
In the middle of René Kovacs,
qui était neurophysiologie, tu sais qui est mon maître, niveau psychanalyse.
and who is my teacher.
Et vous avez le docteur René Bourdiol, qui a suivi aussi, qui a apporté beaucoup, lui il est neurophysiologiste aussi, et il a apporté beaucoup aux bases neuroanatomiques et neurophysiologiques de l'auriculothérapie.
And René Bourdiol, who was a neurophysiologist, and who brought tremendous knowledge to the basis of neurophysiology.
Vous voyez, donc en 1987, l'OLS reconnaît officiellement la discipline.
In 1987, the World Health Organization recognized officially these disciplines.
En 1990, la première nomenclature, la première nomenclature internationale des points a été publiée.
In 1990, the first international point nomenclature was published.
Et en 1994, à Lyon, en France, c'est devenu le premier symposium international d'auriculothérapie et d'auriculologie.
And in 1994, in Lyon, in France, took place the first symposium on auriculotherapy.
Voilà, c'était au mois de mai.
It was in May.
Voilà, alors depuis, l'acupuncture auriculaire a été reconnue et validée officiellement par l'OMS en 1987 à Séoul. Une année après la crasse, si vous voulez. Et synthétisée dans une nomenclature internationale en novembre 90 à Lyon. C'est le numéro du bulletin qui est là.
So you can really translate this, but geez, LAUER auriculotherapy was recognized and validated officially by WHO in June 1987 in Seoul and standardized in international plurilateral points. The WHO nomenclature in November 1990 in Lyon, the bulletin number is
Et depuis, de nombreux travaux de recherche cliniques et scientifiques ont été faits et qui ont assis définitivement cette discipline dans le socle de la neurophysiologie.
So since then, numerous work, research, clinical, scientific have been conducted and have settled and consolidated the basis of this discipline into neurophysiology.
Thank you. Next, please. Voilà, alors la définition de l'enquête qu'on a développée, c'est que c'est une thérapeutique visant à traiter les personnes malades par la stimulation physique et si préfet qui varie au l'oreille.
So the definition is a therapy that aims at treating patients through the stimulation, the physical stimulation of reflexive points under the ear. Yeah.
Next. Alors, le mécanisme d'action, je vais essayer de m'expliquer rapidement. Les mécanismes d'action, c'est que ces mécanismes d'action utilisent les voies neurophysiologiques de contrôle et de gestion de l'homéostasie de l'organisme.
So in short, action mechanism they use the neurophysiology pathways of control and of management of body homeostasis.
Et chacune de ces voies neurophysiologiques, par le jeu de leurs interconnexions,
Each of these pathways, a neurophysiological mechanism.
Alors, il faut que je vous dise que toutes les voies neurologiques, neuroanatomiques, neurobiologiques, neurophysiologiques, neurothermiques, neurogénétiques, sont toutes interreliées les unes aux autres.
So all these pathways, neuroanatomy, neurophysiology, neurothermic, and so on, are all interconnected.
Il n'y a pas une seule voie neurobiologique ou neurophysiopathologique.
There's not only one neuropathology or physiology pathway,
Qui ne sache pas ce que font les autres blés.
that is not aware of what others are doing. Yeah. So there's an interconnection.
Voilà. Et les domaines dans le cerveau, nous avons dans la boîte amène 86 milliards de neurones.
Likewise, we have in our brain 84 billion neurons. Yeah.
86 milliards de neurones.
6%.
Et 100 milliards encore. On sait maintenant que c'est entre 100 milliards et 86 milliards.
So before we thought it was 100 billion, but now we estimate
Différents selon les gens.
we're estimating between 86 and 100 billion.
Pourquoi je vous dis ça? On vous dire, seul le neurone ne sache pas à chaque instant le fond.
Why do I say that? Because there is no neuron that does not know at each moment what the others are doing. We are a machine that is absolutely.
Alors, est-ce que l'origine consiste à utiliser les voies neurophysiologiques de gestion de l'organisme parce que chacune de ces voies est interconnectée génétiquement et embryologiquement sur l'embryon sur le porte. Et ce type a déjà identifié.
So there's a genetic origin of these interconnections through these genes that you can see up there, HOX and SPAX and so on, and are genetically and embryologically connected and built upon.
Ces gènes sont les gènes MOX, SHH et PAX, et qui suivent une grande loi de neurophysiologie. Le cerveau passe son temps à obéir à des lois. C'est dans la loi de Keller.
So these genes spend their time obeying to several laws, and one of those laws are Keller's law.
Et grâce à ces processus histologiques, embryologiques, neurophysiologiques, eh bien, au fur et à mesure qu'une somatotopie territoriale se porte, elle doit se déposer comme un vote. En même temps, comme vomiteur.
So this is l'autrement. So encore une fois.
Chaque fois qu'une somatotopie périphérique se forme,
so each time a peripheral somatotopy is being constituted,
en même temps,
at
elle
the same
se
time,
déposer sur sa représentation à l'oreille.
it comes and gets imagery representation on the ear.
S'il vous plaît. Suivant. Voilà. Alors, je vous ai parlé des gènes os. Les gènes os, c'est une contraction de ce qu'on appelle homéotype OX, et généticiens qui l'ont appelé comme ça.
So these HOX genes are constituted by homeopathic genes.
C'est ça, homéotype.
Okay.
En plus, ils sont responsables de la formation de ganglions antéro-postérieurs. Généticiens disent antéro-postérieurs, donc le long de l'axe longitudinal. Ce sont eux qui permettent le bon développement dans l'axe longitudinal.
So they're responsible for the development from longitudinal, so from top down of the spine. Yeah?
Bon, il se trouve que ces gènes os, ce sont les nerfs qui pilotent le bonjour qui sont donnés par l'oreille.
So these HOX genes are also the one responsible for the ears, buds development. Yeah.
Voilà.
Embryos. Yeah.
Suivant, si vous voulez. Voilà. voyez, vous avez des gènes os qui vont piloter le développement du tube neural depuis l'extrémité antérieure jusqu'à l'extrémité postérieure ou ciblée céphalopodale, comme vous voulez, antéro-postérieure.
So you can see this HOX gene leading the development of the central nervous system from the head to the tail.
Suivant, s'il vous plaît. Voilà. Il y a un autre type de gène qui s'appelle les SHH, ça veut dire Sonic Hedgehog. Sonic Hedgehog.
So another gene, sonic hedgehog.
Alors eux, ils vont simuler à chaque métamère formée dans l'axe antéro-postérieure, dès qu'un métamère se forme, c'est deux qui doivent intervenir pour que les gènes OX s'occupent du métamère suivant. Dessus encore, les gènes SHH vont stimuler les gènes OX pour qu'ils comblent le métamère suivant. Ce sont des canaliseurs et gènes OX.
So these are catalysts of HOX gene, allowing each metamere to form successively once the previous one has been formed.
Merci David. Voilà. Et enfin, les gènes passent.
Eventually, now, finally, the PAX genes.
Ce sont eux qui ont insisté aux gènes OPS, ORTEN, SHA. Donc, il faut former le long du développement antéro-postérieur, quand il faut former les bras, les avant-bras, les mains, quand il faut former les jambes, les pieds, les membres inférieurs, donc il faut former les organes génitaux, etc. Mais ils s'occupent de la précision.
So the next gene, the PAX gene, really regulate the precision of these visualization. So from at the very organ level. Yeah?
Voilà. Et ce sont tous ces gènes qui pivotent le développement de l'eau et qui pivotent en même temps des développements de l'avion d'oreille.
So all these genes concomitantly at the same time pilot the development of the embryo, but also the ear.
Ce qui fait que chaque fois qu'une somatotopie se forme, elle se forme en même temps sur le pavillon de l'oreille. Sa représentation se forme sur le pavillon de l'oreille.
So each time a somatopia is informed at the embryo level, it is also replicated and mirrored at the ear level.
Voilà, vous avez ici un schéma que font les gènes POX, les gènes PARS, les gènes SHH. Ce sont eux qui pilotent tout ça. Vous voyez?
So this is an illustration of what these genes are doing.
Et vous allez voir, ce sont les mêmes gènes OS qui vont piloter le développement du premier arc et du deuxième arc qui vont donner le pavillon d'oreille. Et ce sont ces augmentations qui vont appeler les représentations périphériques, les laméliques, et une représentation du cerveau. Et ils sont là.
This is the gene that develop in particular the first branchial arch and the second branchial arch. Donc, le premier et le deuxième,
et ce sont ces gènes qui vont piloter en même temps, la concomitance de ce qui se fait en périphérie et sur le pavillon blanc.
And these are the genes that pilots the development at the same time of what is happening at the embryo level and at the ear level.
Voilà. Vous voyez, le pavillon de l'oreille est issu du développement du premier arc et du deuxième arc bronchial.
So you can see here that the ear pavilion is originating from the first and second arc, branchial arc.
Le premier arc est innervé par le SALU 3, la signe 3 du trijumeau.
So the first arc is innerved by the 5-3, perijumeal, the third trigeminal nerve.
Et le deuxième arc est piloté par le sel, puis exactement par le celpis.
And the second arc is led by the nerve 7, yeah?
Voilà. Alors maintenant, on l'appelle plus le celpis, on l'appelait auparavant l'adhémnésienne, le nusaire.
Oui. 1 second. It's more precisely 7 bis, but right now we don't call it no longer 7 bis.
Voilà. Maintenant, on sait que cette racine difficile prise par les anciens anatomistes est tout simplement la racine sensitive GIUSEPPE.
So it is actually right now being recognized as the sensitive part of the nerve, the seventh nerve.
Ça veut dire que le nerf fascia, c'est le nerf facial, c'est sévère, et il a, comme tous les autres nerfs, une racine sensitive, une racine outre.
So the facial nerve, nerve 7, has, as the other nerve, one root that is sensitive and the other one that is mild.
Merci. Et on recommence. Et vous voyez que le premier arc et le deuxième arc vont donner des bourdons. Le premier arc va donner 3 bourgeons. Le deuxième arc va donner 3 autres bourgeons.
So we can see that each of these arcs are producing buds, and the first one gives 3 buds, and then the second one gives another 3 buds, making in total 6 buds.
Voilà, t'as quoi. Et suivant, s'il vous plaît. Et voyez, ce sont ces arcs, ce sont ces arcs qui avaient marbré, qui vont donner le labeur du regardez, du schéma.
So you can see that these parts that are being innovated. How to say that in English?
Innovative.
Innovated by innovated by the 5, 3, and 7 that give rise to the ear.
L'oreille est innervée par le 7, le nerf 7, le 9, le 10 et le plexus cervical du père 10e.
So and you can
Le 9, le 10 et le plexus cervical du père 17.
and so in addition to the superficial plexus, you can see that the ear is innervated by the 7 bis, the 9, 3, the 5, 7, et le 10.
Le 5, le 7, le 9 et le 10.
Yeah. So
5, 7, 9, 10.
5, 7, 9, 10.
Et le plexus
7 and the 9 and the Okay. Merci.
Voilà. Ensuite, vous voyez les cas tels que le 5, le molécule du 5, c'est lui qui va innerver le premier arc et le deuxième arc.
So you can see that the
Premier arc et le deuxième.
the first and the second arc are being innervated by the 5th
Le
nerve.
9, le 9, c'est lui qui va innerver aussi le deuxième arc.
The 9th nerve, facial
9,
cranial nerve,
vient,
also the second arch.
il vient d'un grand noyau qui regroupe le 5, le 7, le 9 et le 10.
This I'm going to need to take a break. So, the 7th, the 9th, and the 10th nerve. Yeah.
Et vous voyez, c'est constitué deux grands nerfs, le 5, le 7, le 9, le 10, qui sont reliés ici au niveau d'un gros noyau ici qui s'appelle.
So these
Comment ça s'appelle?
7th, 9th, and 10th nerve originate from these these nucleus. Voilà, that's it.
Suivant, s'il vous plaît.
5.
Voilà. Et regardez, le ganglion, ça c'est dans le plion. Vous voyez, dans le plion ici, de 3 semaines. Regardez les solidités cérébrales, des cellules cérébrales qui viennent se jeter dans le 5, dans le premier arc et le deuxième arc, via les nerfs 5, 7, 9 et 10.
So you can see in these 3-week-old embryo how the cells are being deployed into these different parts.
Oui. Vous comprenez que ces gènes, les racines du LUCENTI sont pilotées, gérées par les fameux gènes qui gèrent eux-mêmes la périphérie.
So you imagine and can understand now that these cells are being controlled by the same genes that control the rest of the body development.
Voilà. Vous voyez ici le développement du soi-disant de l'oreille, qui est issu de ces deux arcs, et les 6 bourgeons, vous voyez, le bourgeon 1, le 2, le 3, le 4, le 5, le 6, qui vont former le pavillon de l'oreille.
And so you can see how these arcs develop into different buds that will form the ear.
Dans le guet, vous voyez se jeter toutes les représentations de la périphérie et du cerveau.
And so in these 6 buds, you can see the representation of the whole body as it
Vous
develops.
voyez, cet embryon au 56e jour du développement embryonnaire, son pavillon est déjà totalement fait.
So at the 56th day of embryo development, the pavilion of this embryo is already established.
Et il recèle en lui toutes les représentations du corps, biceps compris, solar compris, et du cerveau.
So
Ça est projeté et venu se déposer dans le pavillon de l'oreille.
So the pavilion, ear pavilion contains in itself all the representation of the body, including internal organs.
Ça aussi, c'est la genre qui nous explique, vous voyez, les développements du caméra suivant.
This is the same thing that explains it.
Vous voyez finalement que ce sont les 6 bourgeons qui vont former le pavillon de l'oreille,
So you can see here the six parts.
dans lesquels vont venir se représenter toutes les structures neurologiques et toutes les structures thoraciques.
So all neurological and physical representation of the body are mirrored in these six parts. And
Voilà. Vous voyez, vous avez au 44e jour, vous voyez le pavillon de l'oreille qui est totalement formé, et c'est tout le cerveau et tout le corps qui sont venus se représenter sur le pavillon de l'oreille.
so seeing here at the fourth day of development,
Vous voyez, à nouveau, on va bien se lever en suivant 6 mètres. Suivant. 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 Joli. Voilà. Juste un mot sur l'organisation topique du système nerveux. Il faut savoir que nous sommes agencés de manière à permettre, je vais lire la phrase ensuite, je vous le dis, de manière à permettre à tous les instants, en toutes circonstances, le maintien de la meilleure homéostasie possible à tous les étages de son organisation pour toutes les fonctions physiologiques. Oui. Il faut qu'à chaque métamère, à chaque étage, il y ait une gestion parfaite.
so at each level of these metameres, you really need a perfect coordination of these different structures, so that so that it maintains the best possible homeostasis at all times. Wow.
On va passer à la suivante.
Next.
On va passer. Excellent. Voilà. Vous voyez les métamères, le schéma de neurologie des métamères qu'il faut connaître par cœur si on ne peut pas faire de ludothérapie, si vous ne savez pas d'où vient la base de neurologie, lequel est le métamère ancien, le métamère se situe, sinon vous ne savez pas comment pianoter sur le clavier auriculaire.
So you need to learn all these metameres by heart, otherwise you will not be able to play on the metamere and auriculotherapy keyboard.
Voilà. Si vous voulez, le cerveau est un ordinateur dont les pavillons d'oreille sont des classes D.
In other words, the brain is the software, the computer, and your pavilion and your ear is the keyboard.
Suivant. On a fait ici un schéma neuro-anatomique et neurophysiologique du fonctionnement de l'auriculothérapie. Vous avez le corps avec les capteurs, les récepteurs, vous connaissez, qui vont amener toutes ces informations au cerveau. Vous voyez, ça va arriver au niveau de la formation articulée. Allez-y.
So this is a illustration that shows the neuroanatomy and neurophysiology with these afferent inputs that reach the reticula.
Voilà, au niveau de la formation articulée, voilà, hésite l'oculus tête en bas, où hésite une représentation de l'humain comme un petit oculus tête en bas.
So where there's a projection of upself, a homunculus head down.
Et l'oreille, vous voyez, est branchée sur la formation réticulée, vous voyez, par intermédiaire des nerfs 5, 7, 9, 10 et du pécus vers une cage superficielle.
So through the nerves that we mentioned before, these homunculus is being projected and linked within the reticula. Correct? In English, reticula.
Voilà comment nous sommes représentés dans le cerveau. Voilà comment nous sommes représentés dans le cerveau.
This is how we are.
Un artiste, bien sûr. Hein. Mais voilà comment nous sommes représentés dans le cerveau, tel d'en bas. Vous voyez, les lèvres sont très représentées. Les pulpes des moelles poussent en avant. C'est très beau des anglais.
So this is how we are represented artistically in our in our brain with the lips and hands and other parts of the body and the genitals being heavily represented.
Suivante, s'il te plaît. Suivante. Suivante. Voilà. Donc, vous voyez, ce sont toutes ces démonstrations au niveau physiologique
So these are all these neurophysiological considerations
qui fondent les principes neurophysiologiques et neuroanatomiques de la guidance.
that form the very basic and the foundations of neuroanatomy and neurophysiology of the ear.
Voilà. Comme j'ai l'habitude de dire à mes élèves, le bas de l'oreille, c'est pas du flaqueur, c'est de l'or massif.
So as I used to tell my students, the ear is not just plaqué or meaning covered with gold, it's gold 100%.
C'est la raison pour laquelle il faut éviter de les trouver là. Maintenant aussi, il faut plus transverser de l'oreille. C'est d'abord si sur un clavier, vous en dites une ou plusieurs touches.
So that's the reason why you shouldn't pierce your ears. It is as if you were taking away from the keyboard one or two little letters, keys.
Ça, c'est massif. Voilà. Ici, j'ai plus le temps pour vous expliquer comment on agit quand on, ou peut-être rapidement, si vous me permettez. Je vais aller une minute sans.
So I don't have much time here, but okay.
Bon, physiologiquement, 70% des informations qui viennent transporter dans le cerveau de l'état dans le chimètre le sol,
So 70% of the information coming from our body to the brain,
par le jeu de ce que je vous ai montré auparavant, vient se déposer sur le papillon de l'oreille avant d'aller au ciel.
through the pathways I described before, will first reach the ear before reaching the brain.
Et les autres 100%, eux, vont directement au ciel.
And the other 30% would directly reach the brain.
Voilà. Quand il y a une pathologie, quelconque,
When there is a disease,
les potentiels issus de cette pathologie morte viennent se déposer sur le papillon de l'oreille, ils vont se...
so the potentials, the electrical potentials will first go and reach the ear before reaching the brain.
Les points du papillon de l'oreille ont la forme d'un bonnet.
So the points on the ears just look like how you say it? A little goblet, a little glass.
Voilà.
Yeah.
Voilà. Et un clan normal, lui, contient que les potentiels normaux, que les potentiels préhensifs normaux.
So a normal physiological healthy point would only have healthy potentials.
Par exemple, tout bas en nous, l'estomac a une fréquence de 105 Hz.
So for instance, what is the Hz is the frequency of the stomach.
La fait ici 42 Hz.
So bladder 42 Hz.
Donc, un estomac normal va envoyer des potentiels de 105 Hz qui vont se déposer dans le point de l'oreille. Quand ils sont normaux, ils vont pas être sélectionnés par le point. Ils vont pas être gardés par le point. Il va reconnaître la normalité des potentiels et il va les laisser partir au cerveau.
So a healthy stomach will send this physiologically healthy frequency to the points in the ears, and the ear will recognize that it is healthy and will not keep it. It will not keep it and send it, let it go to the brain.
Voilà. C'est une pathologie. Il est d'abord que 50% seulement des potentiels qui vont emmener au cerveau sur les 70, parce que 20% vont être retenus par le point. Et pour connaître la normalité fréquentielle.
So in case of pathology, so the ear will recognize and would keep 50% of the frequency and will let go only of 20 into the brain.
Alors le cerveau, il n'aime pas ça. Il veut être informé en permanence de la totalité de ce qui se passe en périphérie.
So the brain doesn't like it. It really wants to inform at all times of what's happening perfectly.
Alors, il sait qu'il y a quelque chose dans ce map.
So it knows that there is something wrong in the command.
Alors, il va mettre en branle, il va activer des processus de défense.
So the brain and the body will start a defense mechanism.
Voilà.
Yeah.
S'il réussit à soigner le problème, oh, ça peut marcher normalement. 70% bien, passe dans l'oreille et dans le cerveau, il n'y a pas de problème, tout fonctionne bien.
So if things are being healed and goes well, it goes back into the normality of 70%, reaching the ear and going into the brain. Yeah.
Si le symptôme n'arrive pas à soigner l'analogie, ben, il va considérer cette pathologie devenue résidente. Vous avez vivre avec.
So if the brain cannot heal the pathology, it would consider it as a commensal, a residence with whom he will need to live.
Voilà. Alors, vous arrivez, thérapeute, producteur, acupuncteur, auriculaire, vous allez traîner le point. Vous allez traîner le...
So acupuncturists or therapists will come here and will treat the point.
Voilà. Faire une aiguille, ils sont bombardés,
Either with a needle,
soit par une aiguille cellulaire maintenant,
so or semi-permanent needle,
soit par une aiguille cellulaire.
or without a freezing cryogenic needle.
Vous avez été ce point, et en prenant le point, vous allez perdre complètement l'information de l'enjupant de cerveau. C'est le cerveau qui a pu recevoir, zéro information.
So by treating these two ways, you will block what is being sent from this point to the brain. The brain will receive no stimuli.
Et alors là, le cerveau ne supporte pas.
And there, the brain cannot stand it.
Parce qu'il a besoin de ses potentiels pour alimenter ses cartes sur la nodopie.
Because it needs all this potential in order to feed its somatotopic maps.
Et donc, il va déclencher. C'est une disposition.
So it will start on all processes that it has in its hands.
Tous les processus. Parce que la première fois, il les a pas tous déclenchés. Parce qu'il ne veut pas des derniers qui se font.
So I say here, all the processes, because the first time when he tried to heal it, he didn't use all the process at hand.
Voilà. Et c'est ça qui fait que quand vous avez détecté, le cerveau va utiliser de puissants moyens d'énergie qui vont régler le bordel.
So therefore, when you treat the point, the brain will then use all its tools and all its therapeutic power in order to heal the pathology.
Et il va réussir à le régler 7 fois sur 10.
And it will manage to heal it and treat 70% of the time.
C'est à peu près le pourcentage de l'action thérapeutique de l'auriculothérapie, le succès thérapeutique, il est entre 70 et 80% selon les statistiques.
So that's on average the success rate of either 70 to 80%.
De nombreuses études de l'auriculothérapie, c'est le suivant.
Numerous
16 salles en 2 livres, on tient le cœur, avec, nous avons démontré que quand on simule un point à l'oreille, on allume bien dans le cerveau l'air correspondant qui le gère, et sur la d'autodite qui le gère. Là, c'est le pouce, le pouce. À gauche, vous avez la simulation du pouce par une aiguille.
So here is there have been many studies, among which one that I led, 2002, with a stimulus of the thumb, à gauche.
Là, donc, on a enregistré l'air du cerveau qui gère le pouce.
So left thumb area in the ear, and you can see its corresponding stimulation in brain.
À droite, on a simulé à l'oreille le point du pouce.
Okay. So on the right side, it's the area of the ear that corresponds to the thumb. From the left side, it's the thumb itself. Yeah.
Voilà. Et on a obtenu exactement la représentation.
And the same representation, the same results were obtained.
Démonstration mondiale, neurophysiologique des bases scientifiques de l'auriculothérapie.
So these were one of the first results that established the neurophysiological foundation of Neuro-acupuncture.
Internationale qui a été faite.
So many things have been done at international level.
Internationale de l'OMS, reconnue par l'OMS, et qui est celle de votre serviteur, après avoir travaillé pendant 3 ans et demi à peu près dessus au laboratoire, dans mes machines d'IRM, etc. Nous avons proposé à World Federation, à l'OMS, à World Health Organization, on a proposé cette nomenclature, et vous avez ici la nomenclature internationale de l'auriculothérapie, de les touches du clavier des cercles.
So here are the keyboards of the brace included here. They were established after the 3 years of MRI LAUER.
Bah, c'est la dernière pour la prendre.
This is the last one. This is
Les outils utilisés sont liés.
so these are the therapeutic tools that are used to treat
Les réduits semi-permanents,
the semi-analysis
extemporanés,
needles,
le cryoauriculotherapy.
therapy.
Vous voyez qu'on fait on injecte un spray,
This is a spray
marquer le point, derrière la même chose que les 800 les inconvénients,
that will stimulate to screen the point without the side effects.
et avec une puissance d'ILN fonctionnelle d'un et demi de plus que l'aigu.
Alors répétez ça.
Avec une puissance ILN fonctionnelle
So we don't have power
de plus que l'aigu.
with a power that is 1.5
La dernière.
MRI
Voilà.
power more than the needle. So
Voilà, donc ça, c'est les réduits semi-permanentes à gauche, les réduits extemporanés. Ça aussi, il y a le traitement du myélite.
so myelitis, myelitis treatment of the right.
Et à récupérer, suivi maçon.
Voilà, cool recover.
Voilà, merci les choses. Pour les points, des
The next speaker is Professor Wang.
The board of Italia. As you know, the Scuola mentioned that the first blue acupuncture conference was held 2 years ago in London, in my affiliation from the first, the second in Siena, the Scuola, and CECILIA. Not so far. So we are looking for the boards, making that year in somewhere in the other European countries. It is, yeah, okay, let's start. Because of pyramid, today is some kind of general chapter about my research and the clinical experience about the mechanism of skeletal culture from the brain stimulation type of the neuro imaging. And yeah, so thank you. That's all. So very briefly, I will say for today's talk, I will more focus on the kind of research on the hypothesis regarding for the mechanism of skeletal, which is the pathway of neuro-acupuncture or part of the pluripotent acupuncture for neurological conditions. And also there's something like today is something like introduction for the tomorrow and Sunday for the lotion and cellulose. For I believe some of you has registered for the lash. Well, yes, fine. Next slide, please. All right. So I'd like to start with the currently research the hypothesis about the step acupuncture mechanism of action. Based on this research published in 2020, there are several different hypotheses about the mechanism of cell lunging, including hemodynamics, hemomyology, brain electrophysiology, biochemistry, and immunology. That is the 5 actions regarding for this research publicly. So I'd highlight the top with red is the brain electrophysiology. I will make it available here later. And put this. Oh, thank you. Don't slide. I'll see you. Oh, so sorry. Part of this publish really was kind of to highlight something more with is the shortcut pathway between the scalp acupuncture and LIGUORI. That shortcuts why several can generate so rapid, effective clinical results. So based on this research, solely from the human science and the animal experience. So the several can get a shortcut of the pathway between several and the Then, 2023, another greenhouse by a professor in America. This is the neurocontrol of cerebral blood flow. We say the scientific base of the scapular in treating brain diseases, published by the frontal neuroscience. In this research, we highlight the general possible the scapular mechanism, which including the theory of channel acupuncture. As you know, acupuncture previously the Philippo or region or from the body league about the channels here. So everywhere, like that channel is including on the head. There are several channels including male, convex woman, then black channel, which is put up, then the side channel that we full shine, and both the full yummy. All channels, the several channels along the set. So when we new set, it can stimulate these channels and the dots. Let's generate the reaction based on the channels here. That is one the explanation. Second one, put a biological hypothesis, which is similar to ear acupuncture or acupuncture. It's the small part of the body can generate a biohydropathic this mechanism. So, which is the cortical functional area, which is the similar at the hairs on the head of the cell, which is directly shortcut generate the stimulation into the underneath the gray cortical areas. That is the shortcut, which is based on the general hallucination and the neuroscience branch, which in why this self-acupuncture was funded by a neurosurgeon called Professor Sulfacchio, as Cecilia mentioned in the book. This self-acupuncture was first published in 1971, the March 80s, by a neurosurgeon. During his study in acupuncture, he realized if we only needle the horns underneath such a tricky stroke, they can generate some results to break, but not as soon as you needle on the head. At the beginning, he used on head according to traditional acupuncture, horns on cheek, but finally, based on his knowledge of neuroscience, he changed the simulation area and the not according to the channel pulse, but for some of the catched pulse, but majority based on the cortical function areas, which generates more power, more clear effectively use something for neurological diseases. Then published in 1971 and widely, rapidly explained to the whole national China and covered in the national education curriculums in Chinese medicine education in China. Well, I was a student in early 1980s. And soon, 2 to 3 years later, a city abridged 2 years later, a journal in Canada has already researched and published the paper. It has to mention 2 or 3 years ago in China, a new technique published, which more effectively to the neurological diseases. Thank you. So in total scale of acupuncture, when we use the needles on the head. Subclass, we also connected with electro stimulation. So you can see on the left side with my practice on patients. The top one is dementia. The later one is a stroke. I put needle on head with lepio. On the right-hand side, you can see this is the EEG, which is a base of the brain-computer interface. They looks like quite similar reaction. Second, we use the knee outside. We use a head meditation. Sometimes we has electrical stimulation. But for the EEG, or based on the brain computer interface, they use the electromagnetic to get the sensation or the signals from the brain. The next slide. They get the sensation from the brain. Then they analyze it from computer. They may send the signal back to the brain. There are three key types of the PCR brain computer in the next slide. But this one can say, you can use the brain computer interface and to simulate the brain based on the signal. So you may be making the acupuncture on scalp, which also simulates the cost-hormonal zone by the hand lubrication or electric. That is something integrated or corresponding on chart technologies. That nowadays there are three kinds of brain computer interface. The first one is invasive with arm. Of course, this is a more highly technology. You use the very which is really to the third degree to put a simulation inside the brain. Of course, at the top, but also totally dependent. Musical elemento tutto. The work very Then the last one is a non-invasive PCR, which means we do not do the surgery. We select the signal on the surface of the gap. Then we use different stimulation. It could be an electromagnetic. We could use the legal stimulation. We may class electron, which is partly or similar to the non-invasive PCR. Of course, not a foot of the surgery are more precise or simulated deep, but it is a generally safe and easy and convenient simulation for the brain stimulation. Thank you. As a acupuncture practitioner and also the professor, one of the questions I was asked by many times by my patients, the fairly serious, what's the mechanism for cells? Do you have any areas? And of course, we have treated many indications. CECILIA, myself, from doctors, many or had it in. But what's the mechanism inside? So nowadays, more and more research have indicated, based on the functional MRI, they found the different cortical function zones can be different response when we need to different areas of the brain. This is a newly published 2025 by professors from Harvard Medical School and China Institute, the Chinese medicine universities. But artificial sclerosis and brain stimulation target for common neurological disorders added from neuroimaging study only this year, in May 2025. They indicate we have identified a special cortical targets for sclerosis associated with the 10 neurological disorders. The diverse the model on 10 different doctors. According to their more than 10, they have done emotional as well. So you can say our findings are broadly consistent with current sclerosis protocol, while introduction additional new stimulation exact. Now, the imaging they said collectively these findings demonstrate the symptoms potential for breaking these treatments, validates its methodology application in chronic pain and comorbid disorders, etc. Next one. As a sample of shock, in next paper to have 10 neurological disorders, I choose only now for a sample of stroke. Post the stroke affects, as you know, this is a very quite common problem after stroke. One of the top 5 disorders of stroke. There are 7 different kinds of stroke. Of course, we may use different stimulation, treatment, etc. But also quite hand, where most people are right-handed equivalent. But it is our left hand is more functional active. So if our left hand is damaged, whatever stroke, whatever accident or cure, we are more possibly lose our speech. But on the other hand, if we are lucky, most are already on the right side of the grade. We are very less possible to lose our speech. That is also the evidence by clinical studies and evidence. So this one, you say 83 studies provide 128 analytics and 2,000 coordinators for superficial executive. Neuroimaging finds identifies 3 categories. You call the PS1 left, the left, the middle supervisor, and etc. Or the left here, they are all on the left side. That is the imaging. Then the bottom imaging is the 3 element or step level simulation. They are very, very closely correspond each other. Which means when we choose this step equipment areas for the first big area, which is the most used for the motor video, that is practically put the control their tongue. They put the hand silence, but they couldn't control the tongue. You couldn't make they only made a slurred speech. The second speech, which we call the non-linguistic abyss, which means the patient they can make speech, but they can't tell you the name. Such as you ask them, what's this? They say you can let it call, but they can't tell you it's the full. Or you can say this. Even what's this? You can say, oh, really put right. They can't tell you the name. This is the pain. We call it non-linguistic. Last one, we call the third speech area, which is the patient's book, but they can't measure up verbal communication. You ask them, how do you come to treatment? Normally they say, apply, electrify, head-to-shape. But this is identify rebels or knowledge or English rebels. They can't understand what you mean. We call this the sensory of this. These 3 post-stroke abysses has each corresponding in 3 different cognitive functions. They are very, very close, more than 9% corresponding to trial. This is a sample. For one morning, the workshop, I'm happy to explain more detail about the location of these 3 of this year, the location, and some other general set of areas which are used to treating stroke. Okay, thank you, please. The other research also indicate, such as this one, effectiveness scapular and the comparing with clever for stroke. An overall of systematic review and updated evidence, which is published, let me see what year? 2025 as well. This year only published. So I try always to update my knowledge and also share with my colleagues. Updated only this year as you fresh. So the findings say scapular showed a great effective site in the neurological deficiencies. In total studies and high quality studies regarding motor function, SA has a higher effective site in total studies. And this overall highlights the potential of scapular as an effective alternative therapy for stroke research recovery. With high quality studies demonstrate its effectively improved neurological deficit and stable outcome. So this is also a new research. One piece. And of course, there are some others, such as this one, about modulatory effect intellectual cellular acupuncture on brain activation in the elderly as verified by the respiratory state MRI. So this is the particularly China and the United States, more acupuncture research has used this more active live the what we call the functional MRI to discovery about the mechanism of acupuncture, including scalp acupuncture. Next one, please. Of course, this one is from this result. I think you okay read. So I do not read the text. So let's make it the cerebral highly present in patient who have present up to stroke. Please. Yeah, this is the also images from the existing research. The advanced science you might have to read them. I have already give you the reference. Yes, please. Yeah. So then we move on for a little bit about the details set up. How to generate the serial acupuncture effectively simulation on the brain. Today is not a workshop to demonstrate. I'll talk about tomorrow and the weekend. I can demonstrate a little more detail. Acupuncture, as you know, acupuncture. That means we needle on scalp between the skin and the scalp, the bottom, which is under, you say, the loose area connected tissue. It's not for people. It's under oblique, roughly about 20 to 30 degrees to insert it normally around 3 to 4 centimeters that inside. Then we also need to rapidly meditate the ligor in a frequency about 200 minutes piece per minute, roughly about 3 movements per set to generate a biomagnetic stage, which means the electromagnetic signal generated by the repeat twisting stimulation of the brain, which is one of the key factors of the effectiveness of stimulation. So we need for acupuncture, first of all, we need to find out where we put the needle. Secondly, we need to insert needle in a right ankle and depth inside. Third key factor is the manual of the fish, which generated good signal to the brain. Yes, please. And widely speaking, as I mentioned at the beginning, acupuncture is one of the techniques of brain, or we can say neuro-acupuncture. But here I prefer to use the brain because neuro-acupuncture is good for neurological disease. But anyway, I use the word brain acupuncture, which is not only neurological, but also psychological disease. We may use the acupuncture to generate a better result. So for brain acupuncture sites, we have some key points. The first one is TCM, or traditional Chinese medicine, or traditional Chinese medicine, has brain, and it is above the other sub-order. If some of you have the foundation of Chinese medicine, the theory, you understand, in tradition with the acupuncture, nowadays, some reason, brain is only one of the extraordinary organs, which is not as important as sub-organ of the body. But actually, the acupuncture theory from 2,000 years of age and recently 50, 60 years research has indicated brain is the sub-organ and with even high level than other sub-organs. Secondly, brain controls knowledge and regulates the mental and physical activity. The channel, one important channel for the domain government by research in China. When I was a PhD candidate in China 30 years ago, we focused to use the government or domain partners to treat the brain conditions. My PhD research was the acupuncture for depression. As you know, typically when we're treating depression in acupuncture, we majority use the points on the heart channel, on the liver channel, etc. But actually nowadays, based on the new research, we more use the acupuncture and the domain funds for treating medical disorders. The I still remember Filippo made the sweep regarding for the anatomy of the Hondileji, exactly. One of the important Hondileji statement for brain, which is under New Su chapter 33, called the brain is the seal of memory. It opens on the 12th scalp, and then below are the 2 men to 16 bones. With this 2,000 years ago, in Hondileji, our ancient master has already realized the anatomy, physiology, and pathology about the brain in some setting. So brain is the seal of memory. It's organ or it's chi. It transfers to the top of the cell, which is one of the key references of therapy. So we say Scalp and the Daoji tablet are the special and highly effective methods for brain-related appropriate. Yes, please. This is my book, as the moderator mentioned, just mentioned, published in 2021 today by Scuola, called the name called Acupuncture for Brain Treatment for Neurological and Psychological Disorders. In this book, systematically a summary about the TCM brain seal, including some of the anatomy, physiology, pathology, from traditional aspect and updated aspect of neurological research. I want to simulate brain exercise. And the 2 chapters introduce the technique, including scavenger and the Daoji technique. During this conference, I will more focus on the neurological human culture. So tomorrow at least, and also the Sunday seminar, I have studied even more on the scavenger for neurological conditions. Tomorrow morning, we'll focus on stroke. Tomorrow afternoon and Sunday all day, I will demonstrate and explain some of the scavenger for some of the neurological conditions, including dementia, multiple sclerosis, etc. So hopefully we can do it more extension. As you can say, the second part about the treating of brain conditions, including some of the neurological conditions and psychological conditions. So I believe this book so far in English publication is the newly published book, which is summary from the interpret of traditional Chinese study acupuncture and newly neurological knowledge on the treatment of neurological diseases and psychological. Yes, please. Now, show summary. It's time. Yes. Okay. First of all, there are different hypotheses on the mechanism of scavenger have their own merits. There are several different hypotheses. And similar to body acupuncture, as I said, scavenger have a comprehensive effect. Not only general here, not only high difference, not only the clinical function rules, they are mixed. The multiple uses. Brain electrophysiology is one of the mechanisms of scavenger. But I believe that is one of the I don't think it's the best. I think more relatively, visibly, and easy understanding mechanism under modern society. Really easy to explain to the patient, to public, to understand your therapy, to accept your therapy, and more confidence for your therapy and the future results. The development of brain-computer interface provides a new insight into the mechanism of scalp. As I mentioned, there are now is brain-computer interface. Now it's a more replicate the high technology in not only the but also medicine. The stimulation of the brain by the electromagnetic signal generated by the rapid pistol of scavenger is one of the key factors of effective guard. That means we generate a better guard. We need a certain amount of stimulation to generate getting down. By the way, bring from your science guide us to use scalp control to treating various difficulty brain-related conditions. So that is my short summary. Thank you for listening and welcome for questions.
So the next speaker is Aldo Liguori. Aldo is the Vice President of World Federation of Acupuncture Societies, President of the Italian Association of Acupuncture and Traditional Chinese Medicine. He was for 25 years teacher and coordinator of acupuncture master to the Sapienza University in Rome. His topics today is on abdominal acupuncture in cerebrovascular disease.
Good afternoon to everyone. Among other activities, Paracelso Clinical Center and my association have tried with the annual study trip since 1987 to learn from hospital in China, especially in Beijing, the best and the most effective TCM clinical practices. In 1987, we met in Beijing Professor Bo Ziyun, who developed the best modern systematization of abdominal acupuncture. Since that date, I have closely followed the study, research, and clinical work of Professor Bo Ziyun in Beijing and in Canton. This is the hospital in Canton where Professor Bo Ziyun works. The regional hospital of Guangzhou, Canton, like all regional hospitals in China, performs more than 10,000 traditional Chinese medicine treatment per day. On the 21st floor, there is the abdominal acupuncture department, where patients from the entire hospital are referred, but mainly from the Department of Neurology, Orthopedic, Rheumatology, and Emergency Medicine. It collects every year an extensive and amazing clinical experience. The Chinese clinical experience is really wide and deep. Since 1989, Professor Bo Ziyun entrusted me with the task of representing his institute, the Beijing Abdominal Acupuncture Institute, in Italy and in Europe, assigning me the responsibility for research and teaching in all Europe. Since then, the first and second level abdominal acupuncture courses have been held annually in Italy and occasionally in various European countries, such as Germany and Greece. The research activity has been carried out mainly in Italy and in Denmark. In 2017, our clinical center in Rome, the Paracelso Clinic, was awarded the prestigious title of China-Italy Center of Traditional Chinese Medicine by the China Academy of TCM, also in consideration of the work carried out in Europe for the promotion of abdominal acupuncture. Some word about abdominal acupuncture. Abdominal acupuncture is a method focused on an acupuncture very original microsystem. Its theory and practical application were drawn from ancient knowledge and developed with recent insight by Professor Bo Ziyun in China in the 70s. It is a comprehensive method, often remarkable for its exceptionally rapid therapeutic effects, not only on pain syndrome and neurological diseases. Abdominal acupuncture depicts a new regional form for the mapping of the meridians network at the level of abdomen, making clear that moving in depth in this area from the surface to the inner layer, we first find the regulatory network of SUNGCHOL, conceptual vessel 8 microarea, that develops early, being inborn in the embryo, the turtle map, the so-called turtle map. Then the actual Jinluo meridians and collateral network, finally the acquired Jinluo network, the level of Sanfu or Bakua map. The congenital Jinluo system is able to send the information and the resources necessary to organize the formation of the embryo and fetus. The system passes through the umbilical cord and controls the gradual development of the fetus. According to Professor Bozzi-Yung research, in fetal life there is a present and active congenital Jinluo system which at birth, at the moment of the cutting of the umbilical cord, will pass on the command of the distribution of qi and blood to the Zanfu. But the innate system remains operational and can be reactivated to treat disease with the abdominal acupuncture. This is the outline of the turtle map placed on the abdomen, with its head oriented toward the xiphoid apophysis of the sternum and its tail toward the pubic symphysis. You can treat in the superior area the correspondence diseases of superior part of human body, and the same for the inferior part. The range of application of abdominal acupuncture is very wide, even if the largest experience has been made in the area of Penfield syndromes. You can have a result in osteoarticular disease, in cerebrovascular disorder, in disorders such as anxiety, depression, and ache, and so on. This is the abdominal acupuncture map. You can see some correspondences in the central line on the conceptual vessel. You can have some correspondence. For instance, the 12 conceptual vessel is the mouth, and also the head. And then you have the correspondences with the different level of vertebrae. For instance, the first cervical vertebra is conceptual vessel 1. The 7 cervical vertebra is conceptual vessel 7, and so on. Under the navel, you have, for instance, 6 conceptual vessel is the level of lumbar 1, lumbar 2, and conceptual vessel 4 is the level of lumbar 3 and lumbar 4. About needle, I would like to say that the diameter of needles in abdominal acupuncture are usually 0.22, 0.20, 0.18, 0.14. It's very thin. Abdominal acupuncture often acts very quickly, And another advantage is that it's more comfortable in report in relation to somatic acupuncture. Abdominal acupuncture has no needle stimulation and therefore avoids the so-called needle sensation like tingling, swelling, heat, or heaviness, which sometimes can originate intolerance in more sensitive, fearful people. And to be effective, abdominal acupuncture needs a very superficial insertion of needle. Okay. Next slide give an idea of the therapeutic potentiality of this macro system, making reference on one hand to the 3 layered systems that can be reached with the insertion of needle at a different depth. On the other hand, to the body areas involved in each of the above 3 layers. There are different ways to present abdominal acupuncture. For instance, different depth of needle insertion, different distribution of systems, different body areas involved. The most important aspect is that abdominal acupuncture is based on the congenital system of meridians located under the surface of the skin around the navel. So we can consider that we have 2 different methods. Somatic acupuncture, which need the selection of syndrome and the qi. You have to make arrive of qi, no? You have to move needles. In abdominal acupuncture, it doesn't need to be activated the qi, and you can work also without syndrome differentiation. It means that when we don't know well the patient, abdominal acupuncture it's very interesting method, no? It's quick and you can observe patients and you can make the first, second and third application acupuncture treatment in very easy way and with a great comfort for the patient. And we can use together the somatic acupuncture and the abdominal acupuncture. Okay. We should consider 3 different levels. No? The first superficial level is the level of abdominal acupuncture. When you treat this level, you treat the congenital qi, the yuan qi. Usually, yuan qi precede, it can before the other qi, yin qi, ron qi, and so on, wei qi, and so on. It moves before, okay, and it's very quickly the effect. And then, if you study abdominal acupuncture, after the first step, you can study that every step have different level. Every level could be divided in 3 levels. And according to the theory of abdominal acupuncture, you can have different effect according to the depth of insertion. If you put needle superficial, you have effect on the turtle. You can use the mechanism of turtle if you insert a needle very superficial. If you insert a needle more deep, you have the level of meridians. And if you put needle deep, more deep, you have the level of Sanfu and level of Pakwa. This is interesting. The same point can have different effect according to the depth of insertion of needle. In terms of evidence, when we study acupuncture, traditional Chinese medicine, I think we have three levels of knowledge. One is the evidence, another is the narrative thinking, and another is clinical experience. In this context, I would like to report something about the evidence, and we did some research. In this group, I noticed that one of these research is in 2014. We used the laser evoked potentials, and laser evoked potential are very interesting in research versus placebo and in clinical application, and show interesting effects of abdominal acupuncture on pain matrix. Yes, so the laser stimulation or laser placebo are very useful in acupuncture research especially, and is a good method for placebo. And with laser evoked potential, you can control if the analog thinking is really effective. No? If you have a movement at level of evoked potential, is very sure that you have an effect. We study in some way this aspect. For instance, the N2P2 complex possibly correspond to the affective motivational component of pain, and it is strongly affected by manipulation of attention. Previous studies suggest that in healthy subjects, the N2P2 amplitude is strictly related to the subjective perception of laser pain. In the subject of this research, real abdominal acupuncture reduce the N2P2 amplitude and the laser pain rating. Thus suggests an effect of this procedure on anterior cingulate cortex. However, since during abdominal acupuncture also N1 amplitude was reduced, and the reduction was as long-lasting as the N2P2 amplitude decrease, a primary site of action for abdominal acupuncture in the S2 area can be hypothesized. On the other hand, this is unlikely because N1 and N2P2 components are generated by parallel spinal thalamic pathway. Hence, it is possible that abdominal acupuncture can act on the input afferents to the cerebral cortex at more peripheral level, maybe peripheral fibers or spinal cord. Another effect on pain matrix. Our result showed that both the N1 and N2 P2 potential reduced in amplitude by abdominal acupuncture. Since in the present study only 4 recording electrodes were used, dipole sources generating the LEP components could not be modeled. However, several previous studies on EEG modeling and on intracranial EEG recording showed that the N1 response is generated within the S2 area contralateral to the simulation. The N1 potential is thought to reflect the sensory discriminative component of pain sensation, as demonstrated by its resistance to the modification of attention. The N2 P2 potential is a very complex component, probably resulting from contribution of several brain structures. There is consensus in attributing a relevant role to the cingulate gyrus, including both the posterior and anterior, with particular reference to ACC Brodmann areas 24 and 24. In conclusion, the N1 potential is directly linked to the real perception of pain. So when you have a modification of N1 potential, you have to be sure that the reduction of pain is true. Is not motivated by other sensation, no? But it's very sure method in order to demonstrate the effect. For give you an resume to the abdominal acupuncture, this is a kind of schema, and when you use abdominal acupuncture, you have some phases. The first phases is that you put a needle on the conceptual vessel. You have some protocol, we can see like this. Then you can have many different ways to do abdominal acupuncture, but substantially, you have a protocol for every disease. So the first phase is that you put a needle on the conceptual basal meridian. The second phase is that you put needle contralaterally to the symptoms. Then you have local symptoms, point for local symptoms, and at the end you treat the point of stomach, 24 of stomach meridian, if you have problem up in the superior part of abdomen, and 26 if you have problem in the inferior part of human body. I would like to show you a little video. Is a patient with an ischemia of the left middle cerebral artery with aphasia, dizziness, paresy in the right side of superior limb. Iniziamo con questo caso clinico. Si tratta di una donna di 53 anni che 8 mesi fa ha avuto un'ischemia della cerebrale media sinistra. Sono residuati un'emiparesi destra e delle vertigini. Ha fatto fisioterapia con poco risultato per 8 mesi. Le vertigini sono però completamente scomparse ed è migliorato lo stato generale. Abbiamo preparato l'assistita per un trattamento, per un primo trattamento di agopuntura addominale. Come potete vedere sono stati infissi degli aghi a media profondità sul canale vasoconcezione ed è stato punto il 17 del rene in posizione controlaterale. A questo punto eseguiamo il trattamento di agopuntura addominale per il recupero dell'arto superiore destro. Allo stato attuale la paziente ha difficoltà a sollevare il braccio, provi ad alzarlo un po'. Ecco, si contrae un pochino il deltoide, ma niente di più, e poi nel braccio permane questo atteggiamento in flessione, soprattutto del pollice, un po' meno del polso. Il trattamento quindi adesso inserisce degli aghi in posizione superficiale nei punti che corrispondono all'arto superiore. Sono punti a partire dal 24 dello stomaco in cui l'infissione viene effettuata superficialmente. Vedete, l'ago fa fatica a stare sollevato, proprio l'ago dell'agopuntura addominale, l'inserzione è molto molto delicata. Dopo il 24 dello stomaco ci sono altri punti che corrispondono al gomito, al polso e al pollice. Questi punti sono dei punti extra. Bene, adesso eseguiamo una verifica perché il trattamento, diciamo, è immediato, indolore ed estremamente sicuro. Bene, ecco, adesso chiediamo di rifare il movimento, quindi vedete che c'è un certo miglioramento. Il pollice può essere esteso, il pollice, ecco, grazie, così, ecco, c'è un certo miglioramento. Adesso questa condizione di miglioramento durerà più o meno a secondo della condizione della lesione. Se il trattamento viene fatto nel primo anno dalla lesione, dall'ischemia, il risultato è notevole e naturalmente perderà un pochino questo beneficio di sollevamento nel corso delle ore successive, però ripetendo il trattamento giornalmente per 6-10 volte rimarrà un certo grado di beneficio. Diciamo la risposta è in circa l'80% degli assistiti se viene fatta entro l'anno. Se viene fatta entro i 3 anni, lo stesso c'è il risultato, ma la percentuale si abbassa intorno al 50%.
A final thing, I utilize more Rosaria is very specific. The type of get solution. The couple is the best position. Doing that, we chiefly elbows and Auriculotherapy. Superficial research, the research is very superficial. If you click proper, was like this, the inserting it's a little more. If you put in the superficial, you don't have effect. If you put in a little more, you settle from the letter in the first letter, after is in the first step. If you create the version, for instance, the point 24 is a point of shoulder. If you put in the superficial, you have the effect on the shoulder. If you put a little more, and this adds more, you have the level of meridians. So from meridians, one is not the description is like 24. It is cheese after and with 26, like 6, table sheet, taboo. If you both leave the town girls, I mean, the key says is ready. You have the effect on the sunflower. Sì, hai ragione, io le fanno, le faccio ancora, li faccio tu, sì, faccio così, vedono la freccia, sì, ok, mi siedo qua e gli faccio la a stomach in position position at the session and they can make video investigation. They said, it's very open. They was very rapid. Okay. So last week I called me to my friend who was mine is a neurologist and it was registered the Scalp and regularly Scalp is roughly 50% no. Stop is very good because this area, this one, of lung that is on the left side. If you put laser on the 26 in the right side, which is not part of lung, you don't see any effects. This is a interesting observation.
Finally, Paolo RIPELLINO. So I'm very curious to listen to Paolo's speech and to see how you work in your practice. Thank you.
Thank you, Giuseppe, and good evening. So I will be a bit provocative. When Giuseppe asked me to do this presentation, I asked to myself, why nature made pain? And this is a genetic condition where people are not suffering any pain. And this is a tremendous condition, a terrible disease leading to joint problems, and you see here mutilation of the tongue and many problems in the teeth. So pain has a physiological role. We should remember that. There is a international association for pain, IASP, telling us that neuropathic pain is not rare. It's up to 10% of the general population. And these are the definition of pain: an unpleasant sensory and emotional experience associated with actual or potential tissue damage. And neuropathic pain is pain as a consequence of a lesion or disease affecting the somatosensory system. So this is the basic. There are different levels to classify neuropathic pain. If you just are based on history, so possible symptoms, you will stay in a category of possible neuropathic pain. So the anatomical distribution should be compatible with the lesion in the peripheral nervous system or central nervous system. If you examine the patient and show negative signs, then you move to probable neuropathic pain. And to be really sure, according to these criteria, you should perform confirmatory tests. These are the different categories of pain: nociceptive, neuropathic, nociplastic. So basically, nociceptive is the physiological activation of the receptors, so we all have that. Neuropathic means that there is a lesion in the PNS, peripheral nervous system, or central nervous system. And for chronic, by definition, the literature says this is lasting more than 3 months. Then what is chronic neuropathic pain? There is an official definition based on also, again, anatomy, central and peripheral chronic neuropathic pain. And these are the conditions that we as neurologists see: trigeminal neuralgia, chronic neuropathic pain after peripheral nerve injury, could be also a iatrogenic lesion or a trauma, painful neuropathies, herpes zoster or postherpetic neuralgia, and much more often painful radiculopathies. Central pain can happen after a spinal cord injury, a brain injury, multiple sclerosis, so a demyelinating disease, or as a post-stroke consequence. You see here some example: pain after amputation, so the phantom pain, very rare in my experience, but it's really unbearable. Trigeminal neuralgia, painful radiculopathy, not only due to disc herniation. Remember, it can happen also after an inflammation of the roots. Polyneuropathies, especially amyloidosis, is associated with pain. Injury of the brachial plexus, trauma, motorcycle accident, for example, spinal cord injuries, In the literature, they say it's in up to 50% of the patients, so really relevant. And then post-stroke, and we have an example later. So this is the basic, the physiology of perception, and you can always find the literature below. So if for those who are interested in knowing more, just read these papers, the originals. For nociceptive pain, if there's no stimulus, there's no pain. And then if the stimulus is applied for a sufficient time, then the threshold is reached, and then the patient is experiencing pain. This is normal, this is physiological, and this is the anatomy of perception. So from the receptors, these are the pathways. The impulse will travel through the sensory neurons. These are called also T cells because they are they have this T shape neurons, and the dorsal root ganglia. Then there is the nucleus, and then the impulse will go to the spinal cord, the dorsal column, then brainstem, thalamus, limbic system activation, and then the somatosensory cortex and the contralateral side. This is physiological. What happens in a pathological condition? So there is a damage in the peripheral nervous system or the central nervous system. So along the way, the patient can experience pain also without the stimulus. This is the main difference. So there is a constant pain without the stimulus. And this is not physiological, and the threshold is reached with less impulse, so it is easier to experience pain. And there are other phenomena happening, like amplification in the central or peripheral system. So we mentioned there is a damage in the nervous system. These are the receptors. In a nice review from a big expert, Ralph Baron, you see the receptors already known in this complex field. And I wanted just to stress that when you put your needle in the skin, you will activate the C fibers and the A delta and A beta fibers. And we come back in a minute on this. And for neuropathic pain with peripheral nerve damage, the nerve can be demyelinated, or it can have an axonal damage, and then this has a consequence also on the expression of the receptors, changing the excitability of the peripheral nerve. So again, this is the physiological condition. There is a stimulus, then if the stimulus is lasting enough time, there is enough impulse to reach the threshold, and then the neurons will fire and then conduct the impulse, and then the patient will have this perception of pain. Okay. In hyperexcitability means that for a pathophysiological condition, the nerves are hyperexcitable, maybe transiently, and then it's easier to reach this threshold, and there will be after discharge after the physiological stimulation. In pathological conditions, these fibers are already stimulating without stimulus, and so the stimulus is continuous, as you can imagine. So this is just to understand better what happens, what is behind when the patient is telling you I have constant pain. So this is the curve of the normal response. You need to increase the stimulus intensity to have an increase in discomfort. In allodynia, when the stimulus is below the normal threshold that we have, the patient is already experiencing pain. So this is allodynia, a stimulus that is not usually leading to pain is perceived as painful. We have to mention this gate control theory. There were experiments in the 60s and 70s And I think this is relevant for acupuncture as well. Just to mention, there are different fibers. We already said C fibers. They are small, they are unmyelinated, and they have the function, the physiological function of giving a perception of pain that is lasting more and is more intense. And there are bigger fibers with myelin, so myelinated fibers, and they, since they are bigger, they conduct much more faster than the smaller ones. So these fibers from the primary neurons will have a synapses in the spinal cord with the secondary neuron, and then from the secondary neuron, then there is the pathway we already discussed to the brain. But what Melzack, as Melzack pointed out, there are inhibitory circuits in the spinal cord. So the large fibers will stimulate the substantia gelatinosa, and these interneurons will inhibit the stimulation. So they call it this as a gate control. So they're like a feedback. When the stimulus is too intense, then there is a natural feedback to slow down the impulse. And you can imagine if you have small fibers always stimulating the secondary neurons, if we apply acupuncture or a TENS, for example, we just discussed now the pose, continuous stimulus will provoke an inhibition, a stimulation of the inhibition, and therefore reduce the painful stimuli from the C fibers. So this is a possible mechanism we have to take into account. But we all know already that there are also inhibitory pathways from the brain. So these are called descending pathways. And we already know the mediators of these pathways: noradrenaline, opioid, and serotonin. Imagine that from the brain, there are these mediators going to the spinal cord. And you see, when there is a pain stimuli, then these regions, so the limbic system will be activated, and then the locus ceruleus will produce noradrenaline, for example. Nucleus rafemanius will produce serotonin, and periaqueductal gray matter will produce endogenous opioids, but we can also use, of course, drugs with the same effect. And all these mediators will have the physiological function of reducing the pain perception. And this is very complex. There is also, and we should not forget, the involvement of the limbic system. So these areas that in the brain are very, very old, very old, but they have the function of controlling the emotions. So these circuits are always involved with pain, especially with chronic pain, and they modulate as well the subjective perception of pain. And also, I will just mention that inflammation can play a role in the whole system, increasing the susceptibility of the neurons to conduct the stimuli. So increase the what is called sensitization. So I thought it's also good to have a clinical perspective, what we do as neurologists. First of all, we listen to patients, so ask adequately with enough time about the symptoms and to describe the symptoms they have. For those who are interested, there is this nice review. I will just mention briefly the main symptoms. Hypoesthesia means a reduced sensation to non-painful stimuli. Hypoesthesia means a reduced sensation to vibration. And remember, our system has different fibers for these different sensations. Thermal hypoesthesia means a reduced sensation to cold or warm stimuli. Then paraesthesia means there is a non-painful, because it's just para, ongoing sensation. paroxysmal pain, shooting electrical attacks for seconds, lasting for seconds, and allodynia is pain from normally non-painful stimuli on the skin. There are scales to quantify the pain. You see, there are many. They are used mostly in research. What I suggest to use is the VAS, so the visual scale, where you score the pain from 0. So the patient has to score the pain from 0 to 10. NRS is the equivalent numeric scale. But also for, if we speak about neuropathic pain, use the DN4 questionnaire. So a French questionnaire, very simple, based on 4 questions. It takes a few minutes, but you know, it helps to distinguish neuropathic pain from other type of pains. So you ask to the patient, does the pain has one of these characteristics: burning, painful, electric shocks, yes or no? It takes really few minutes. Is the pain associated with one of the following symptoms: tingling, pins and needles, numbness, itching? And then you ask if, for example, if in the painful area, the pain can be increased by brushing, yes or no? If the patient has more than 4 out of 10, this is very likely to be neuropathic. So this is free. You can download online. It's helpful. I also suggest when you visit the patient to define with just a pen the painful area. So you remember there should be a lesion, so you should be this area should be compatible with the peripheral lesion, for example, or a central nervous system lesion. If you want to test the temperature, just take a glass of hot or cold water, and for allodynia you apply tactile stimulation. That usually is not painful, but if there is damage, if there is a neuropathic pain, it will be painful for the patient in a certain region, and then test for hypoesthesia with the pinprick and the cotton wool. We also use always the diapason. This is for the vibratory sensation. We let the diapason vibrating and ask to the patient in certain body regions if the patient, we ask the patient to tell us when the vibration is finished, and then you see there is a scale on black and white, and you can really quantify if it's 2, 4, 6, or 8. And you have to adapt this scale according to the age of patients, because it's physiological that over time the vibration sensation is also reduced. But this will tell you if there is, for example, a polyneuropathy of the large fibers. And then we have imaging exams, MRI, CT, nerve ultrasound. I'm a big fan. I'm doing it since 8 years now. We can do nerve conduction studies or somatosensory evoked potentials. There are more fancy and complex tests that neurologists can do, pain lab can do, but also, and now it's almost routine, skin biopsy. So somatosensory evoked potentials, we use it in the clinical practice to show if there is a damage along the sensory pathways. It will not measure the pain. It will tell you if there is really a problem along the way, for example, a tumor or a demyelinating lesion and so on. But this is really objective, so it's helpful to test. Nowadays, of course, we have MRI. It's much more easier to do MRI and localize the lesion, but there is still a role for this kind of test. Another I want to show is the skin biopsy. So you take with the punch biopsy a small piece of skin. You see in comparison with €1 how small is
the piece of skin that you have to analyze at the microscope, and you see on the left a healthy subject with these tiny fibers that are the small fibers, and in a patient with impairment of these type of fibers, you don't see these fibers, or you see less, so a reduced number of these type of fibers, and there are standardization in the lab to quantify these. I will just mention that there are international criteria for trigeminal neuralgia. Probably it's a diagnosis that is abused in the common practice. Remember that usually it's in the mandibular part of the trigeminus. If you mix maxillary and mandibular, it will be 95%, so it's very, very rare in the ophthalmic region. The features of the pain is lasting a fraction of a second up to 2 minutes. The intensity is severe, and the patient will describe as electric shock shooting or sharp in quality. And it's usually precipitated by innocuous stimuli. You see the triggers like touch of the skin or cold and so on. There is sometimes there is a secondary cause, so the compression by a vessel, and in this case, if you show it with MRI and you are sure, and the pharmacological treatment is not effective, then the treatment is microvascular decompression, and this is reviewed here in New England. Finally, a recent meta-analysis and systematic review on the drugs that we use for neuropathic pains. It's practical because you see also the dosage for each class of compounds, and you see they divided according to studies in the literature, so evidence-based medicine. They divided first line, second line treatments. First lines are alpha-2 delta ligands, so the gabapentin and pregabalin, and again first line SNRI inhibitors, so duloxetine, and also first line tricyclic antidepressant, so amitriptyline. These are all drugs, but they are still first line. But remember that the expected result is 30% up to 50%. So a 30% improvement with one of these drugs for an appropriate time, which means at least 4 weeks, then is considered meaningful. But this will tell you the limits that we have. So these drugs often are not effective or are not well tolerated, so the patient will stop, and that's why I think there is a role also for acupuncture, for example. Then second line treatment, lidocaine, capsaicin, and third line botulinum toxin. Okay, this is a figure with the receptors. We mentioned the alpha-2 delta are expressed, receptors are expressed here in the spinal cord. If we apply carbamazepine and other sodium blocker, they will act on the sodium channels, and there are new drugs now blocking these type of channels, and this is the new frontier. I will just mention a possible bridge between Western medicine and Chinese medicine. I read this book. I suggest you to do the same, The Spark in the Machine. As already pointed out at the beginning this afternoon, the fascia could be a possible link to explain at least some of the effects of acupuncture. And in my clinical practice, I see many patients with myofascial pain. So I do EMG, electromyography, the patient has pain, referred pain, MRI is negative, electromyography is negative, but the patient has pain. So where this pain comes from? And then that's why I started to have a look to this type of atlas Travel and Simmons described this very, very nicely. And it's plenty of people suffering of this type of headache and of this pseudo-sciatica that, you know, sometimes maybe is also operated and it should not be. And I also asked it to myself, discussing with another colleague, if some of the points that are commonly used in acupuncture are also correspond to the trigger points. And there are studies in the past with the controversies. So some said there is one under correspondence. Somebody else said no, it's much lower. But probably there are possibilities of contact, especially if we consider the muscle-specific Ashi points. And this is my personal experience. I don't know if somebody else already said that, but I want to mention this because I think it's real. You see, the fascia is a neglected tissue, but it's there since millions of years, and nature did it for some reasons. And we know that nerves, especially the sensories, tiny nerves, they can cross the fascia. And we also know that, and this is based on the studies of Professor Stecco in Padova, we can see the fascia with ultrasound. Beautiful. You see here the correspondence between the anatomy and the ultrasound. And this is a nerve that is crossing the fascia. It's a superficial sensory nerve. It's a sensory nerve. The physiological function of this nerve is to conduct stimuli. But imagine if the nerve is entrapped in the fascia. What happens? There will be continuous stimulation to the system, and this is painful. So there are several conditions like that. Meralgia paresthesica, due to the entrapment of the femorocutaneous lateral nerve, the neuropathy of the superficial radial nerve innervating this region of the forearm, or as I mentioned just 1 minute ago, the superficial peroneal nerve. So in my experience, local acupuncture is effective to reduce fascial stiffness and release the sensory nerve at entrapment site. It can be the median nerve at the carpal tunnel. It can be one of these tiny sensory nerves. But remember that this is also existing. I show you one case. I asked to the patient to come tomorrow morning, so you will ask yourself. A patient who was operated by the orthopedic surgeon expert for the shoulder for supraspinatus tendon problem, September 2022, but a few days after the operation, the patient had an unbearable pain. He could not sleep anymore. So he was really suffering. And he was complaining of pain in the dorsal region of the forearm. So the surgeon thought maybe this patient has a C5, C6 radiculopathy. Let's ask for MRI. This is standard. And of course, as a standard, you will see at a certain age some possible contact with the root, but not very sure. The complaint of the patient was nocturnal intense pain, electric shocks, and big impact on sleep. So next, the patient was sent to me for EMG at month 1. This is what the patient was taking at month 1. He just sent me a screenshot of what he had in his table, you know, before going to sleep. This is what he was taking every day since 1 month, but still with no success. EMG was normal, so this was not pointing to C6 radiculopathy. But when I visited more carefully the patient, you know, the pain was not starting from the neck. The pain was only here, only in the forearm. And I asked, well, there's something wrong. And he said, well, everything started after I started to use a brace. Because, you know, after the shoulder surgery, they need to use a brace, but it was too tight. So I thought maybe there is a compression of the superficial radial nerve here, and I did the ultrasound, and now probably it's too small to appreciate this, but this is not working, the video. I don't know, because you have Apple and I'm Microsoft. But well, I could follow I identified the radial nerve, the motor branch, and then I followed the sensory branch, and I saw that the pain was exactly in this point. The patient was telling me pain is exactly there, and this was exactly the point where the sensory branch of the radial nerve is branching the brachioradialis muscle. So the nerve was crossing the fascia. In that exact point, he had pain. So it was his trigger point. And so I said, what happens if we apply 4 needles there? And the pain immediately disappeared. He wrote me the next morning, I was so happy I could sleep, and he stopped any kind of drug. And so this condition is described in the literature as chiralgia paresthesica. It's rare, but you know, maybe now. No. Okay. Just to conclude, another case with stroke, coming to the emergency department for nausea, vertigo, ataxic hemiparesis on the left, and hypoesthesia on the right. So he did the MRI. He had this kind of lesion in the brainstem. Probably the origin was a cardioembolic stroke, very reduced function of the heart. And you see in this region, it's really a problem because fibers are very densely packaged. And so these are the fibers that were damaged and explain his symptoms. So vestibular nuclei will explain the vertigo, and descending spinal tract will explain the hypoesthesia in the face, and so on, spinal thalamic tract, and but you see, this type of pain is really resistant sometimes. After 3 months of stroke, he recovered from stroke, but apart from pain. He was complaining of invalidating burning pain in the right face, and this is what he tried: pregabalin, duloxetine, amitriptyline, gabapentin, tapentadol, acupuncture, blocks of the superior cervical ganglion, and also repetitive transmagnetic stimulation. So I asked to the patient to come tomorrow, but he is traveling to the United States, so he will not join. To conclude, don't see things only on black and white on both sides. I think there are points of contacts. Trigger points are one of those, possibly for research. And this is Lugano from the airplane. And remember that this is the field of pain is an expanding field, and several researchers got a Nobel Prize in the last years for discovering the receptors, and this is a moving field, and also especially with the pharmacogenomics, we know more and more about this.
Thank you. Last word, thank you all. Thank you, Professor ALIMI. Thank you, Professor TIANJUN. Thanks very much to EOC and Neurocentro of Italian Swiss. Thank you to Giuseppe Peloni. Thank you to Massimiliano Scuola. See you next year in Paris.
Okay. Grazie a tutti e
Giuseppe, foto.
Okay.